Right, okay. Actually live. Hi YouTube, hello. Hello and welcome. As you come into the chat, I know... Oh, this is who I need to speak to. Give me 1 moment, everyone. Hello. Yes, I got your message. Yeah, definitely. Yeah, definitely. Yeah. What was the problem before? Right. Okay. Okay. All right. Okay. Come on up. Absolutely fine. We can slot you in. Okay. All right. Cheers. Bye now. Bye. There's a lady after the address who I haven't answered.
Yeah, right.
So I know it's like, hello everyone. Hi. Sorry, I can see the chat's going crazy in there. Hello. We'll come to questions in a little bit. Welcome. You are here on the Cavy Central page, and we've got lots of health checks. We've got a lot going on here for you today. So welcome, and I will come back to the chat shortly. Can everybody hear me? Just let me know in the chat if you can. Hopefully that's all good, and we're going to get underway. Okay, so let's have a look at your piggy.
Right here. She's a bit skittish, so she might try and run.
Oh, we'll grab her.
That's Toots.
That's all right. Nice. How old is she?
She's about 2.
2. You're gorgeous.
We got her from a fruit and veggie shop.
Did you?
Yeah, they're all stacked in one cage with bunnies and everything like.
Oh,
Yeah, poor baby. So it took her a while to settle in at home.
yeah. So how long have you had her?
About 18 months.
18 months. She's super cute. She got in there. Where is that, Missy? She's got something stuck on her skin there. There, that's better. Her nails are great. You actually don't need, you don't need to do a nail clip there.
Oh, that's good.
So, are you struggling with cutting black nails? Is that
I do, but I just take the bare minimum off.
each
just
time
don't like doing it.
and go back further and further?
Yeah, I'm too scared.
Yeah. Do you know the method that we teach?
Put the spotlight underneath, the flashlight underneath.
No? No. Okay. You need the 5-step method that we use, and we teach everyone how to use that. In the chat, I think I saw Marsha there. Hi, Marsha. If you can pop up the 5-step chat, 5-step process for black nails, that would be great. Thank you. And then when you go back to YouTube, you can actually see the link.
Oh, okay.
Just click on it, and it takes you through carefully how to do that. Yeah, the nails themselves here don't need to come back any further at all. And we always leave a little bit of nail on them, like that one there. We could take the tiniest point off, just only that one.
Yeah.
And because it's the tiniest little point, I would use something really, really small, like little pointy scissors, which are hiding there. Because you can literally just take off the tip like that very easily. There. See, it's just literally the tip. Because you don't want to take any more off there. That one's even had it off. So she's gorgeous.
Thank you.
Yeah, she's really lovely. She doesn't have any lumps or problems. She's lost a little bit of weight, maybe because she's been out.
She's a very chunky pig though.
Yeah, she is a big piggy. Just keep an eye on her weight. Are you weighing her?
I do, but I haven't weighed her for a few weeks.
Yeah, I would weigh her. She's not going to. I've got her. Because see how you can do this underneath her.
Yeah.
This looseness indicates some weight loss.
Oh, okay.
So keep an eye on that with her. But she's beautiful. Yeah, she's lovely. And even her ears are doing well. Do you do their ears out?
No, I don't.
Yeah. Okay. This one's like we can do a little bit of a wipe out, but there's not like it's not. Yeah, it's not really anything we'd worry about. So yeah, literally, this is malaseb in water
Okay.
that we use. We literally just
Like that.
do this, and you'll see we'll sort of wipe out the waxiness that's there. You can sort of feel it when it's just sitting there.
Yeah.
But her ears don't have any fungal, which has like a rough feel to it.
Okay.
So she's in great condition.
Oh, that's good.
Yeah.
I do feed them very well. I don't know if I'll weigh it.
Yeah, just keep an eye on her
the
weight. It might be the heat in the last few days. It can throw piggies out enormously. And
So I bring them indoors, like in the air conditioning when it's really hot.
okay,
And they suck a lot in their hide.
yeah,
Because they're in a confined space.
yes,
Because they're used to a really big cage and outdoors.
okay, yep. So you're cautious of them doing
Very
that.
much so, yeah.
Yeah.
When it's 30 degrees, they come inside.
Good. Yeah, we've had some. Last Monday it was nearly 40 degrees,
I know.
so
Yeah,
very
they were
very
good for
hot.
you that day.
Yeah, had a few.
They've been in quite a bit this summer.
Yeah. So some piggies pass away in that.
Yeah, I know they were.
Yeah.
I'm
There
not
we
saying
go.
that happened.
Yeah, but no, she looks great.
Oh,
Let's have a
good.
look at your front teeth there, Misty. Let's see. Oh, good.
They're good?
Yeah, they are good. She's actually got a bit of a discoloration on her top teeth,
Okay.
which
Not brushing.
she's not quite brushing, but it's more staining. But her bottom teeth,
Oh, I see. Yeah.
her bottom
Yeah.
teeth are fresh and white,
Yeah.
but the top ones are discoloured.
Yeah, right.
So that's at the moment nothing to worry about, but I would keep an eye on that because it may be that she injured those top teeth and it may have slowed her down a little bit
Okay.
in eating.
Yeah.
Might correspond to the weight loss. So just overall keep an eye on her.
Yeah.
She's great.
Okay, I'll take her.
There we go.
I'll bring you another one.
Yeah.
Thank you.
Got her?
I've got her.
Yeah. There we go. Next piggy. Well, awesome. So, just see if Suzanne has anything to help with over there. Yeah. And we can get your girl out to nurse as well. Okay, hi and welcome everyone. Welcome, welcome. So we have a day which is overcast here in Sydney, which is really nice because we've had some really high temperatures up into the 40s. Yeah, just hitting 40 actually last Monday. A lot of people, a lot of phone calls and messages to me that they'd lost piggies or had problems with them in the heat. So again, you know, just being mindful with guinea pigs of the temperatures. So we've got Marsha, hello and welcome. Hello Sally, hello Constance, hello Jake. Oh, thank you Marsha for popping that up. That's wonderful, wonderful. Okay, Coco.
There you go.
Coco, hello Coco. Hi. Hi, sweetheart. Yeah, so Coco's lost weight too.
They must be all.
Yeah, so, yeah. Yeah. Yeah, so they're all losing weight. So something is going on with that. So definitely take their weight today.
Okay.
Let's talk about heat stress on guinea pigs for a minute, just for everyone online as well. Okay, girl. Yeah. So when we talk about heat stress for guinea pigs, firstly, they don't perspire.
No.
So guinea pigs, when they're in warmer conditions, they have no way to cope with the heat and the added temperature. So what happens is their inner core tends to heat up, and that causes additional pressure on what is already a fermentation system. So when they eat grass, they're known as hindgut fermenting animals, and that means that it's a bit like a lawnmower. When you cut grass and you have a pile of grass, it warms up. If you put your hand on it, it's warm. That's because it's breaking down.
Yep.
And that's the process that's already underway. So with these piggies, when they encounter additional heat in their system and they can't perspire, they can't regulate that, it impacts their fermentation system. So one of the problems they can get is bloat. So the first problem is the heat, which they can die from, but let's assume they survive that. Then it starts to affect their gut. So they're trying to cope with having had a hot day, but they've got an irregular sort of system of fermentation occurring through all the different parts of their digestive tract. So we tend to find that if you can give those animals a little bit of Infocol, it can help settle that.
Okay.
Yeah.
Yep.
And you know, it's really, if they've got a bloaty sort of tummy, you would do that. So she doesn't feel bloaty at all,
No.
but she's definitely lost weight.
Yep.
So we might take a look at these girls' rear teeth as well. But yeah, with the weight loss, like she's actually lost more. She's even got, see, she's got loose skin down here. So I know, sweet pie, it's all right. So yeah, her nails, again, you're doing a great job with the nails.
Oh, good.
The little bit of white that you've got on there is fantastic. So you leave that so it's protecting their feet, which is good.
Okay.
What's going on with your teeth, Missy Moo? Let's have a look. Okay, so I'm just going to lay her down here. And just over there on that side, I'm looking for a little pillowcase that's there. That one, yes. Thank you. Wonderful. Go. She's beautiful. But let's just rule out that there's nothing happening with her teeth, because there's quite a bit of weight loss with her, a little bit more so than the other one. So put my little glasses on here. Now she's got exactly the same pattern. Her top teeth are dark, stained, and the bottom isn't.
white.
Yeah, exactly the same. Okay. They're looking okay. Yeah, so her molars are fine, which is great. Yeah. So, yeah, but interestingly, she's got the same pattern with her teeth,
Yeah.
which is really fascinating.
Wonder what they're eating.
I don't know.
Yeah.
It looks dark. Are they in a dark wood cage? Have they got wood in their cage at all?
CNC cage.
CNC.
Yeah, it's all CNC. It's all open.
Okay. Oh, she's actually got some hairlessness down here as well. She does. Yeah. So she's got a little different problem down there. But yeah, if we look at her teeth, can you see the teeth again there? If I hold her like this, can you see the
Yes,
top?
I can. Yes, I can.
Completely distinct from the bottom teeth.
I don't know
So
what they'd be chewing on.
yeah, so the top teeth are grading on
Unless they're
something
chewing on
darkish.
bars.
Maybe. You have to just observe them a little while, but it's really fascinating that
They're
both
the
have got
same.
the same pattern with their teeth. Yeah, with her bottom, just turn her around, she does have hair loss down here,
Uh-oh. Not again.
see? Yeah. So what was going on before with
They
her?
had mites when I took them to the vet and he gave them ivermectin.
Right, okay.
I've got you know, the kitten revolution.
Yeah, just apply it with Revolution, or we've got Ivermec here as well.
Yeah.
That you can do topically, but we'll just get that treated while she's here. Let me just, can I give it back to you for a minute?
Yep.
So I'll pop some gloves in. Hey, puppies. Yeah. Babies, what's going on? Hey, what's the matter? It's okay. What's the matter down there? Come on, it's all right. A bit moody, aren't they? Very moody. We've got the wind picking up. Said it would rain today. Yeah, it said like 2 mils though. Very little amount, but I mean that's really it's going to evaporate before it hits the ground at 2 mils, isn't it? It's not much at all. But we'll see. That wind is a little bit crazy. Okay. Alright, let's put that. So this is localized. It is fungal.
Oh, it's fungal, is it?
Yep, it is. What have you got as the bedding in their cage?
Fleece.
Fleece.
And I change it like every single day. It gets taken out and dried in the sun.
Are you adding vinegar to the wash?
Yes, vinegar to the wash.
When you wash it? Okay, because generally when there's high humidity, like if the room has high humidity in the
They're in
room.
the shed. So we, like,
Ah, okay.
Yeah,
All right. Yeah, but that's what's going on, is the high humidity.
Okay. As long
So-
as it's not mites.
No, well, they generally come together,
Yeah,
but
yeah,
this is, I would treat them for mites as well,
yeah.
because of the area being at least an inch here. But it's the humidity has got a big bearing on this taking place. So, and being in the shed, that explains it. Have you got fans in there?
Yeah, we've got a fan. But
Right.
they only go out there when it's full.
Right. Okay. Oh, so you keep them in the house apart from
Oh,
that.
on hot days, when it's like under 30, they stay on the grass all day and then they go into the shed about 3 o'clock.
Right. Okay. Because the humidity is what's at play here. Yep. So.
Okay, good girl. Doing a good job. Good girl.
Just slough off a little bit of the scabbies there, which is good. Just going to put a little bit of daktarin
Oh, okay.
in there,
Okay, good girl.
which is just a localized. We use this for ringworm, for
Oh, really?
anything fungal based.
Yep. Can I use
But-
Caniston?
This is better.
Oh, that's better?
Yeah, you will not get the same result.
Okay.
So just don't get the same result with it. Yeah, and if you give them the revolution again when you get home.
Yep.
Okay. Let's do your ears, Missy.
Good girl, Pepe. I know you're having a big day.
It's a big day out, isn't it? But yeah, you're doing good with the nails.
Oh,
So
good.
they're spot on.
I'm glad we did the health check out.
Yeah.
You wouldn't know about that.
Right, yeah, it's coming. And in that position, it's sort of hidden away.
Yeah, it is. Oh, when I pick them up and pat them, I don't look.
Yeah. Yeah, it's worthwhile sort of knowing what's brewing and
So daktarin is what I'll buy for him.
yeah, I would just
Just a chemist.
yeah, just that daktarin there. It is brilliant. The other way you can do it is just malaseb in water, because we affect just over the counter at any pet supply place,
Oh,
like
really?
pet stock, you know.
Yeah. Would that be a better one for me to with?
Well, you will get more use out of malaseb in terms of being able to give them a whole bath,
Yeah.
whereas daktarin is literally for a very specific purpose. Yeah.
Yeah.
So, you know, if
Well
you're
done.
looking to save, then I would do it that way. Yeah.
Yeah, okay. Thank you. I'll go eat another
That's
one.
okay, yeah. Let's have a look at the next piggy. You girls okay in the sun there? Hop under a shade in the shades. Would you like to, Emily and Jessica, would you like to pick a little bit of grass to go in here with these little ones? They're getting cranky in there.
Yeah,
They are. They might want some. Because they can see it, but they can't get to it. So they're letting us know. Buttons. What a cute name. Yeah. Oh, she's happy.
So malaseb is what I put, like, just give them a whole bath in it.
Yes. Just malaseb and water. So you use it like shampoo.
Okay.
That's what we recommend. So, look at this.
So I actually don't put it in the water, just sort of rub it on it.
I literally have a look at some of the bathing videos that I do, and you'll see, you know, I've got the guinea pig in the water being held, squirt the malaseb on the back like you would
Oh,
squirt
okay.
shampoo on your hair,
Yep.
rub it through, and then rinse it off with that same water,
Yeah.
not new water.
water.
Yeah.
Okay, buddy.
It's all right.
Good girl. Come on, darling. Good girl.
Yeah, you definitely need to do that again. She's getting a little bit more hairless through here. So, have they had babies before?
No, never.
Yeah, little foot there. It's got like a little bit of hairlessness just down there.
Is that fungal too?
It is, yeah. So that's what's going on, is the humidity in the shed area. We need to make sure that's lowered. Humidity is actually really, really dangerous for guinea pigs.
Yeah.
Much more so than heat in a lot of ways.
Yeah, right.
It is. They can seem to cope more with the dry heat, but humidity and heat combined is just, it will finish them off as too much. So, yeah. So temperature's bad enough, but if you get humidity with it, it's really dangerous. They're both nasty.
Yeah.
The piggies.
Yeah. Right, Bubs. Good girl. Oh, you're a good girl. Look at that. Look at your ears.
A bit better. Jessica, sorry, would you let Suzanne know that Cecilia is now coming, who is on that list. So she was on again, off again. She's coming.
Good girl, Bubs. I like your grass.
Yeah, you can see here, see how the hair is really thinning through the leg
Yeah.
area into the tummy. So this is like first signs, definitely revolution.
Okay.
And I would give them a malaseb bath
Okay.
just to get on top of anything brewing. But outside of that, she's looking good. She's the one, she's lost a little,
Yeah.
like there's little folds here, but nothing like the last girl has lost the most.
Yeah.
So you need to get a weight
Check.
check today
Yeah.
and then just keep monitoring from there.
Yep.
Yeah, but really good. That's super, super cute.
Oh, good.
There we go.
Thank you very much. I've got a donation to make. Just a small one, but I'll bring it over.
Oh, thank you.
Thank you. Thank you so much. I really
Thank you so
appreciate it.
much.
See
Thank you.
next time.
That is a pleasure. Thank you. Cheers. Bye. Okay. Hi, everyone. We're back. Now, let me just check this message. Dun, dun, dun. Oh, okay. Now, done. Right, okay. So, oh my goodness. Hello and welcome. I've already said hi to you on here. We've got a busy day with health checks all the way through, and hopefully that will be of interest to you. We've got lots arriving at the moment. So how are you doing? Wherever you are in the world, let me know. If you do have questions, we've actually got a lady coming on here, and I don't know if she's watching already. We've got a large number in the chat, but she has had guinea pigs purchased in down near Young, I think it is, and I've been helping her in the last couple of days with rehabilitating them. They've been extremely unwell, and we're going to do a live stream chat. So what I might do now is just, hello, hi, come on down. Chat stream. I'm just going to copy this link. There we go. Yes, right on time for Sonny. Sonny. Oh, okay.
When Sonny's taken
Yeah.
wheels
That's the. So I've just popped into the stream the link that enables you to come online here. So if anyone clicks on that, you should then be able to join us. So let's check. Sonny. Okay, let's see what Sonny's got. Bellamy the bunny. Sonny, what's going on? Look. Come here, Sonny. Am I missing it? I'm trying.
Oh, it's on his cheek. You don't see it on his cheek?
No.
It's all swollen.
I can't see it.
Oh,
I
maybe
must be
it has a
blind.
healed.
No, there.
It was.
Yeah, okay.
So it doesn't seem to be, but he had his eye had, I've been using
Okay.
colloidal silver along with the ivermectin.
Okay,
And
yep.
a lot of pus came out through his eye,
Yep.
and I kept cleaning it. So some of it may have
Yeah.
cleared already.
Feels very abscess-like.
Yeah, that's why it
But the problem in this area is they can get infections into the bone, and it can be a tooth that's causing this, or it can be something, something nasty.
Oh, like
So, yeah, if it's actually into the bone,
yeah.
it can be very difficult to treat because there's less blood supply in the bone.
Yes.
So that's the first problem with it in the bone, and also that you're connected from the mouth, nose and ears.
Yeah.
That's why we have ear, nose, throat specialists,
Yes.
because those areas are closely connected and anything in there can sort of spread very easily. So yeah, I see what you mean. Sonny, what's going on? So we'll have a look at his teeth in a minute. I'm just having a bit of a feel.
It's really in the last week we've noticed it anyway.
Okay.
When I
Yeah.
text you as soon as I noticed
Oh,
it.
okay,
It was
yep.
swollen. So
Yep.
that was the first time we'd really observed it, and I thought, oh, we better get that checked.
Yeah, I'm just feeling to see if there's any sort of nicks or scratches or cuts that could have, caused it. A little bite to their face can cause an abscess area. That's it.
The boys.
Yeah, that's it. So, yeah, okay. Sonny.
Teddy's just here. Okay, thank you.
His eye is a little bit sunken as well on that side.
Yeah, so there was pus coming out through it.
Through the front
Through
section.
here, just the tear.
Yeah, at the tear duct. Yeah.
I cleaned it. Not a huge amount, but
Yeah.
enough. Kind of like conjunctivitis. You know, when you get conjunctivitis, so a little bit.
Yeah.
So mainly at night.
He's lost a lot of weight over his chest area.
Has he?
Yeah,
Okay.
you can almost feel his ribs there,
Okay.
and you can see his loose skin here,
Yeah.
which, but he's quite weighty back here, but that's indicative of something going on.
Okay.
Yeah, he's
Because
quite
he's eating, he
loose through
appears to be
here.
eating normally, and when the food goes in, he voraciously assaults it.
Yeah, I think if you were to really watch him, he's probably not getting the same amount of food as he should be. We've got a really great video which shows 2 guinea pigs eating grass,
Okay.
and when you watch them, in the speed of one guinea pig eats about 6 strands of grass, the other one eats 1. So if you thought you had 2 guinea pigs
Yeah.
diving in to eat the food and they're eating and you walked away, but you didn't actually count the speed of eating, you would then see that actually he's not consuming as much fast enough.
And Teddy is a bit of a guzzler. You know,
Right. Well, those guinea pigs tend to get very tired after a while and exhausted because it takes a lot of effort to eat what they are eating. But just wiping that with some saline. Yeah, he's very lopsided in his face, isn't he?
That's what we noticed. We're like, oh,
Fella,
he's
come
here.
here.
And he did have the lock on his leg too, remember? Just near the joint of one of his
That's
legs.
right.
It
Yeah.
just stayed the same.
Right.
It doesn't appear to have gone.
Is that still there?
Yeah, it's still there if you feel a little lump just at the joining of one of them. Because he is old to use, you reckon he was about 6, I think.
Yeah.
Is it 6?
Yeah, he certainly looks his age.
Yeah.
Yeah, I can't even feel that lump now.
Oh,
Sitting here. So he's got lots of baggy skin on him now.
Oh, unless it's
So
gone.
his-
Is it gone?
It's not one we
Well,
treated,
here,
is
there
it?
it is here. Just there.
Right, got
Between
it.
my fingers.
Ah, okay. Yeah, and that's, yeah.
So you weren't sure if it was cancer or if
Yeah,
it was,
that's
you were
right.
waiting to see if it got bigger. It
Yeah.
seems to have stayed the same size as it was the last time. Maybe slightly bigger, but not.
Yeah, it's really in deep.
Yeah.
Okay, little guy. Let's see.
And he was the one, he only had the one testicle. We did a video on.
That's right, he does.
Said you
That's
felt
it.
something
That
further
was
up.
ages ago, isn't
Yeah,
it?
that's right. With my
Yeah, ages, because he does. He has this one here. Yeah.
You said you also thought maybe it was further up or something.
Yeah, it does. It goes to here. You can feel it. Yeah, you can feel it fully. You can see it there. Let's just cut those nails when we've got the chance. There we go. I think what we need to do is we'll just take a look at what the contents are in that little nose. Trying to hold that at the same time, it's a bad idea. I know. Let me check out. No, we're good. And you're watching. Just trim them up a little bit for him. Then we'll check his teeth. I just want to take a peek inside that mouth and see what's going on in there. Go. Let's wrap you up, Sonny. See what's going on. These little front feet, we'll clean those up in a minute. I know. You're gonna talk to
Like a
me.
little
Let's have a
baby.
look. Let's go. Huh? Let's see. It's a very sore little mouth there. It's very, very swollen, isn't it? Who's inside? Is it? Look, Sonny. He's got his teeth moving in a little bit. Yeah. Not too bad. So that's a good thing. So it is localized to this area. Could possibly be. We might. When did you see the pus coming out?
That was so,
How many days
so
ago?
maybe Thursday, I think.
Right.
Maybe Wednesday night,
Yeah.
Thursday, and then finished up on Friday morning.
Okay.
I think.
Yep.
So it was coming. Yeah. So because one morning he had quite a lot, and I cleared that.
So when you pressed on this, was there more appearing?
No.
No?
It never appeared. I couldn't see where it was.
It
coming
wasn't
out.
the
It was
white
just at
milkiness?
his eye. No, it was a yellowy, runny, yellowy colour.
So it was definitely not milkiness, the yellow.
No, there was no.
Yeah, okay.
It was a yellowy.
Yeah. It's definitely got. What's going on with that nostril? You poor little thing, his nostrils are even being affected by it. Let's clear the edge there. Good boy. Let's see it. Yeah. There we go. Do you want to leave him with me overnight? And what we can do is we can drain that. It's really the easiest thing, I think.
Because it seems like there's something.
No, well, it's definitely infection. What concerns me? His teeth look really good.
Yeah.
So it's localized to an infection. We can't find any sign of a bite or an injury there.
And there was no blood or any. I looked as well, so it's
Yeah.
not like it's healed up.
Yeah, he could have
I
injured.
just couldn't find anything. Could a hay poke do it?
Yeah, it can.
She wouldn't like to see that, would you?
I think we have found it. There it is.
Was an injury.
Yeah, I think so. There. Down through there. It might have been a bite over something. Yeah, I think he's been nipped. And that's what's.
Because I mean, Teddy got me one day. Well, I broke them up.
Yeah.
And he got me thinking it was him. But it
Yeah.
hurt.
Yeah.
Down to both.
Yeah, no, he's had a nip and he's got the area infected. The risk of this though is that it could be caused by something else. His teeth look really good, so there's not that aspect to it. And when we see infection from the bone, it doesn't really present like this. So it's a swelling, but it hasn't got this. It's not quite that. So I hope it's not at that level. He's a bit swollen across the bridge of his nose. So yeah, so we could shave that back and just treat that locally, and do that for him. Yeah, I think that'll be the best thing for him. Plus we can see what's going on as well. How did we get that back there?
Yeah, so his eye's been kind of like conjunctivitis for those few mornings where
Yeah.
I would clear it off using a clothing silver.
Yeah. Yeah, it's gotten on top of it. Yeah, so let's try that, I think.
Okay.
Let's grab his buddy and see how his buddy's doing.
Yeah, she needs Teddy. Can you bring that?
That's Teddy. Okay, I'm back with you.
Got him? Are you doing his foot nails?
Oh yeah, we need to do his fingernails. Yeah, quite right. Come here, little dude. Forgot them. Fix these ones. Yeah, it's alright. Good.
She's an expert.
No, just hold on a sec, sweetie.
Sharp, yes.
Just hold on.
Because he squeals like absolutely. Even when I cut his hair, it's like I'm murdering him, and I'm not hurting him. I'm just cutting hair.
Yep.
He howls the place down. That's why his haircut looks so funny. Because I can't keep going. He's inconsolable.
Oh, Stevie. Yes. you're going to the park?
Yeah, after
Oh, okay.
that new park, they like it.
Oh, which new one's that?
The one just up here, Hunt Reserve.
Oh, right.
It's
They've
really
opened
good.
it.
We went to it
Yeah.
last time we were off with them.
Yeah.
You drained the cyst from it.
Right, okay.
Yeah, so
Yeah.
they have a bit of a ninja warrior thing. You know those pads they jump off?
Yes,
So they
yeah.
like testing themselves on that.
Okay. Excellent. That is good.
Yeah, they've got toilets and everything. It's lovely.
Well, it's always had the toilets there.
Oh, has it?
Yeah, it has. But I wasn't sure what they were doing. It looked like a dog park for a while. It's like, are they
Yes.
changing it? What are they doing? So,
Yeah, they've created a really nice playground there now, and it's enclosed.
okay.
So it's good for younger
Yeah.
kids too.
That's excellent. Let's go and have a look. Let's get that ear a bit better for you, mister. Yeah, okay.
Is it just a nip or something?
Yeah, she thinks.
Yeah, I think it is. We can actually shave that back and we can just put a syringe and just literally see if we can draw it out. It doesn't need to be lanced or anything, but it is full of pus. So just try and lance that out. We have to drain that out of there. There we go. Can I give him to you?
Yeah.
Okay. All right. We can do that in a little bit. Ah, he's got sharp nails. Isn't he cute? Hey, cutie pie. What a cutie you are. Ah, super, super cute. Yeah.
He's got that lovely mark on his nose.
He has. We'll just get your ears done for you. It's okay. That's all right.
Because he's young too.
He's gorgeous. It's like, what are you doing? It's water and malaseb. He needs that on his ears. When you've got teddy guinea pigs, I can feel it on him instantly. He needs his ears really doing. So
Oh, he's got
we're just gonna.
wax, is it?
It's, well, what happens is they get a lot of ear wax, but with teddies, everything gets caught in around their coat. So they
So
tend to
should we
be more,
cleaning his ears as well?
yeah, more prone to fungal. Yeah. So just doing this regularly, like whenever you do his nails, you just
Yeah.
need to give him an ear clean. He has more of an issue than Sonny
Mine
does.
is really nice, yeah.
Yeah. That's fine. Just stops.
Sunny down.
Yeah, he can go down on the grass. That's fine.
So he's going to stay.
Yeah. Well, they can stay together.
Oh
That's
yeah,
all right.
that'd be perfect. He
Yeah.
squeals when he's Sunny's away.
Yeah.
He squeals the whole time.
It's okay. Stay. How long are you going to the park for?
Probably, I don't know, 40 minutes or so.
Oh, well, if
Is
you
that
go
long?
there, I might be able to get it done. Well,
Oh,
yeah,
okay.
for Sonny. So, and then
Oh,
come
yeah,
back
okay.
after.
Yeah.
So that's fine. Yeah.
Perfect.
Yeah. So that's all right. So if you go to the park, leave them with us.
Yeah.
Hopefully we can get that done and sorted for you. Yeah, it's just that it takes a little bit more prepping
Yes.
and what we need to do.
How do you know if it's like, because it doesn't hurt if you're like down?
He's not squealing. He usually
Yeah.
No, he's fine. He's like, he
squeals
knows
like a
what I'm
little
doing.
girl, he does. He's unreal.
doing a bit of,
So he's not minding.
Ear
I think he looks
polishing.
like he's quite enjoying it.
yeah, I'm getting to places that he probably hasn't
Yeah, but
had done in a bit, so.
we never did.
See it? Let's get this here done, eh? Yay. You get like hairs and little bits that come out.
Yeah.
So, and that tickles, like that can get caught in their eardrum.
Yeah.
And there's lots of things can cause head tilt, but one of the things is hairs getting caught down in there. Oh, they've got their head over on one side,
Why do you can
and yeah, and one of the things can actually be hairs in their ears. So when you pull it out, you can see this is like from right down near his eardrum. So it does bother them. It's a bit like if we had gunky ears. But yeah, Rexes are much more prone to it because of the density of their coat.
Is he a Rex?
So he's a Rex, yeah. Yeah. Probably a teddy. Like, he gets long hair, doesn't he?
He does.
Yeah, you cut it back, so yeah, he does. He's a teddy.
So he was quite long.
Yeah.
Then I had to stop some squealing replacement.
Oh, really?
Yeah, and I'm
So
going
sweet.
can't be hurting him. I never knew to purposely staying on the outside.
Yep. Oh, he's super, super cute. Yeah. this one's saline. So we clean up your eye, Teddy. So you've got some stuff in it. Let's get that sorted. Good. It's Teddy called Teddy.
Yeah, Teddy called Teddy. There's a type of guinea pig, a teddy pig.
Yeah.
Yeah, he looks just like a puppy.
There we go. All right.
It's just that he's got some.
Teddy. Wait, we might clean that out for you. Let's do your little claws first. Teddy.
Maybe he can feel maybe some fight hurting when he probably feels my fear.
They tend to notice, they do.
Yeah,
They know
'cause
who's
I'm
handling.
like,
Yeah, they do.
so he'll know you know what you're doing.
Yeah.
So
Yeah. They do
might
know.
start that it's against you.
With the black nails, how do you know like
Where to cut?
Yeah.
It's where the bend is in the nail. Teddy. Don't do that. That's it. And the easiest way with a dark piggy is the 5-step rule. We teach this all the time. So you need a pillowcase. You need soft fleece in the shape of a V. So it's V. So it's rolled in a roll, and then I've bent it. And then you sit your piggy in like that. You support his back. Supporting his back, he's going to fit into here. Hello, Teddy. And then you can literally work on a paw. There are no issues. And you can sit there, you can take your time, you can check out every nail, you can tell him he's cute, and it's very, very easy. It's the same with the feet at the back, but you only ever have 1 foot out at a time, because if the others come out, then they can get out. So if you I keep my finger on the pad, it's like he's standing on the ground. He's happy. But I can now do this. Now, where I can see the curve in his nail is here, there. I squeeze now. See how I'm moving his toe? See, I can actually move his toe because I'm squeezing.
Yeah.
He's not moving, so I can then cut.
Yes.
So you squeeze first. Same here.
Okay,
So
squeeze
it's
first
just
and
here,
cut, yeah.
there. Squeeze, 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 squeeze. Cut.
Oh, yes, yes,
Same
yes.
here. Here's the bend. It's a bit earlier on that one. Squeeze, squeeze, squeeze. Cut. That's how you can do it. It is easy if you follow that method. But put the other foot back. You've got to put it back, like in there, before the other one comes out. Don't we, Teddy? Yes.
He's like, what's going on?
He's like, he's got both out. Come on, I want the other one back. I want this one, Teddy. This one, yes. You're saying you can't have that one. Yes, I can. Yes, I can. Put that one away. I want this one. Thanks. Now you've got to pour out now. This is what I mean by now to do this again. Squeezing, squeezing, cut.
So the squeezing kind puts the dent in it, is it?
See how he pulled back? He's like too soon, too close. He didn't
So if
like
they
it.
pull back,
Don't cut.
don't. Okay.
So we just come a little bit away from that mark, squeeze and cut.
Gotcha. So when they pull, they're telling you. You're
Yeah, it's like
supposed to-
cutting, squeezing, squeezing, cut. There, see? You'll never hurt them because when you're squeezing, it's like squeezing on the pink
Yes.
area of your skin. It would hurt. So that's how we do it. Easy for him. Okay, I'll give him back to you. And then you head to the park. Where are your boys now? Are they in a carrier or something?
The blue one.
They're in there. Have they got shade in there? Hopefully they have. Just make sure it's clipped over the top. Can you check on that, Emily? Yeah. Oh, yeah, that's it. Just so they've got shade, which is great. And then we'll see you back here. Yeah. Yeah, hopefully we'll get that done. That's great. Cheers. I'll see you soon, Ellen. Okay. Bye. Hi, is Jovan here? Yes, hi.
Little chick. Let
have
me
you-
know whenever.
Choc and chip? If you
Yeah.
want to bring them over now, that would be great. Because I think your boys will be a-okay.
Not really for Choc.
Really? So what's going on with Choc?
He's the one who's having the head tilt.
Oh, okay. All right.
And
When did it start?
That was 3 weeks ago.
Yeah.
Started
Okay.
Feb 16.
Is this when we came here? Did you come here with it?
Yeah,
No.
we came here, but no, we came here I think last year.
No. Right. Okay. So it's been a
Yeah.
while.
It's
Okay.
been a while, yeah. So the head tilt happened on Feb 16.
Yeah.
We took them to SASH
Okay.
for an emergency because the tilt was really bad.
Right. Okay. How old is he now?
So they're 2 years and 3 months. So this is Choc.
Yeah. Okay.
Yeah, and then so the vet gave us this picture, the photo gave us medicine for parasite. Okay,
Yeah. It's not a parasite.
and then they told us to give it for 28 days. So 28 day would end this Wednesday.
It's not a parasite.
So
This is the
Okay.
it was working. Like the head tilt disappeared after say 3 days, and so we thought, and then he started to be energetic again.
Bendazole. Okay.
Yeah. And then last Wednesday, the head tilt came back on the other side. So it used to be on the left and then went to right, but now it's back to the left side.
It's actually not great as well.
Yeah.
That's
Yeah,
what
he's
the
making this weird. Yeah, he's
Yeah.
making this weird sound sometimes.
That's-
And I think maybe he's drooling. Got this bad
Just see it.
wetness
See
on
it.
the chin area.
Okay. Let's have a look. So Choc. Yeah, we'll just leave them be for a minute. So Choc, hello. Look at you.
He's not. He has lost weight, just so you know.
A little bit. I've seen piggies that have lost more weight this morning. So yeah. There we go. I might get you to go. You press that dot. Who wants to film? So we might do a little film. Can you hold the camera? Yeah. I'll just keep it on him for now. Just so I can get some different footage of him. Is that his poop?
It's a small one.
Have you noticed it's small? For him it is small.
For the last few
Yes.
days.
Oh dude, look at your head. Yeah, okay. So he was tilting the other way.
Other way.
He's very disorientated. Yeah. Okay. Wow, yeah. So he's tilting the same way though in that photo.
Yeah, so
Yeah.
last Wednesday
tilting
it was
the
on the
same
other
way.
side.
This
Yeah.
one's on the side.
No,
He's gone back.
Oh,
Same.
right.
Yeah, so
Last-
same.
Last Wednesday it was on the other side. Now he's gone back to that side.
Okay. So he's been into SASH
Yeah.
and there was no incident or lead up to it. Okay. Did they look at his teeth? Okay, because that's something very. Sorry? CT? Yeah.
They suggested procedures, but the way they suggested it, when you know to understand rather than
I'm just testing all of his weight bearing capabilities and how he's choosing to do that. Choc. So how long has he been on the fenbendazole?
So it will be his 4th week.
Fourth week.
It should end on Wednesday.
Yeah. can get a calcified bulla, which is an area inside the brain that calcifies, and head tilt is a sign of that. So a normal CT, a normal X-ray would actually show if that's the case. Did they do any scans at all? No.
So they're saying that the X-ray would see.
It would for the bulla. It would for the bulla. So, and this is certainly a case, and that's just a straight X-ray, not a CT scan. So, super glasses. So he's not on any antibiotics at all. No. He's got a lot of discharge from his nose. Have you noticed that?
Yeah, she was saying about discharge earlier.
Yeah.
Starting to sweat.
Right.
We're not sure whether it's coming from jewels, bites,
Yeah.
from the nostrils.
Yeah, because that's interesting. With a bulla, you wouldn't get that, but he could have, like, there could be multiple things going on. Oh, fella, you're not real well. Oh. How does he eat at the moment? He's not eating well. So if I give him some of this, let's just see. Would you like some of that? Show me what you can do. Let's see if he can. Let's see, he can't rip it off me. You can see he's playing. He's trying to, but she's like, he can't get it. A normal guinea pig would have chomped that off, but he can't.
So it's something.
Yeah, he see how he can't. This is just a piece of grass. So he's chewing, but he can't do it. Yeah, so he can hold on to it well, which is good. Is it going anywhere? See how long it's taking? To go, like, taking ages and ages to go in. Yes. Yeah. It's really fascinating how he is taking. He's got such strength to hang on to it. He does, but it takes him so long. So. Try that. Definitely. That's exactly what happens. And a lot of people tend to think they're eating, but they're eating at a very slow rate compared to others. Yeah. Yeah. And so, and by the time they get to wanting to eat more, the other ones hoovered it up.
Yeah,
So
that's
it's
true.
like,
That's what's been happening.
yeah, because he gets it all. So you will have to try and feed them a bit separately at the moment.
We had to
Yeah.
look at temporary area for a couple of days.
Yep.
But I did was one people that pretty much the temporary pulling.
Yeah.
This one's pulling it off.
Okay.
So both of them was like, get this off our one. So
So it's just. So just femendazole. Do they put you on meloxicam at all? Really?
it's the first time I heard that from you.
Oh, really? I'd have thought pain relief would be really good with an anti-inflammatory base. their ears. There isn't. He's very strong in his jaw. He almost doesn't know which way's up at the moment. Yeah, he'll be knocking everything and yeah, he's disorientated. Yeah. Yeah. Look, I think this fellow, and it's not often we see them, but I do think he's a candidate for a calcified bulla. Yeah, it's a bone structure within. It's located in here and it calcifies. And one of the things that they do get is head tilt. So the disorientation wouldn't be a good thing to experience. It's pain-wise generally not, no. But yeah, meloxicam though is an anti-inflammatory, and it doesn't, because something is calcifying, you can't change that, you can't reverse it, there's no cure. There's nothing that we can actually do, but it can minimize pressure on muscles because he's in an awkward position, so there's more inflammation, there would be pain, like if you're kicked up like that all the time, yeah, you're not, your body's not used to it, so there is pain associated with that. And meloxicam can help with that level of it, but yeah, there's no cure for that. So yeah, yeah. So I do think that's the case. Now the only way we can check that is with an X-ray, just a straightforward X-ray. So it doesn't need more than that. And that would sort of rule it out.
Should we go for the X-ray or that's the case? What exactly are the medications say? They give you meds or practically the same inflammatory?
Same. Yeah, they would just do meloxicam, and they would give you an option for euthanasia or, monitoring until it got too bad. His ability to eat is really, really strong. His muscles in around his jaw are great. He's eating very, very slowly, and that's probably more from the disorientation, his head upside down. Like if we tried to eat like this, we'd probably slow down as well. So it seems to be more like that. But yeah, an X-ray would actually show if it's calcified or not and rule that out. Just going to listen to your chest as well, because you had that. Yeah, his chest is clear. His chest is clear, so there's no infection. I'm just going to get a better light and just double check those teeth, because I want to rule out there's absolutely nothing in that jaw that's causing an issue. Generally at this severity it isn't. But yeah. No. And certainly not of that magnitude, and having been on fenbendazole, so no. So you said it picked up for a while, he got a little bit better.
Yeah, for
Yeah.
like 2 weeks straight, he was
Okay.
okay. And then last Wednesday, we saw him again with the head tilt and lethargy again.
Is he still on the same level of fenbendazole?
Yeah.
So-
Super 3.3.
Yeah. Each day, you didn't miss a few days
No,
or
not
something,
at
it
all.
wasn't related
It was
to
the
that?
same time I give it as well.
Oh, okay. So there's no chance of that, because it's like it's come back with a vengeance.
Yeah,
Um,
it's just all of a sudden.
Yeah, I'd be inclined, given that he had an improvement, I would try and keep that up for him. One thing when we've got animals like this is like, how do you manage them in their cage? And some of the things you can do is, for example, create a little towel wrap, put elastic bands around it, so it becomes, and you want one that's the right size, but literally create a towel wrap, and then when, I'll just move this from around him so we can see him, little fella. Okay, so if we put him down, he's down there, he's tilting this way. What you can do is position this. We need a small one, about half the side, but you actually put it on that side, so he's actually got something assisting him in staying the direction he needs to be. But there's quite a bit of monitoring in that, because obviously as he moves away, he needs to be repositioned, and food needs to be accessible right where he is, so he doesn't have to try and get it. Yeah, yeah,
Trying to give him water through the syringe.
yeah. Yeah, his breathing is really fine. It's just, yeah. Yes. Yeah, he's trying to do it. So, yeah. Yes. Yeah. You can even do small wraps. I don't know if I've got a cloth there. Just see if there's a little face cloth down in this bucket for me, like a little small. Is there one down there, small cloth, like a face cloth in there? I'm just looking for a small one. See if you can see something little. No, smaller than that. Yeah, this, okay. There we go. So, yeah. Oh, this one? Yeah, so, yeah, I'll use this one now, yeah. But you can also do this, and we've got videos on a guinea pig called Turtle who had neurological, his eyes are not flickering as well, which is why I'm sort of ruling out neurological, but you can do things like that where you're actually positioning, so propped him with that under his arm so he can see he's a little bit more straight, but it just comes to positioning it. And what you can use is vet wrap to actually position it to them so they move with it, but you trim it down so it's the right length. So have a look at the videos on Turtle and you can see how I did that. So that one's, I know, sweetheart, it's almost, I know, it's okay, don't panic. It's almost double thickness. Let's try. So we're just trying to give him some elevation so he's got a better orientation to be comfortable, and that might be a better position for him. If you want to hold, actually I'm going to try here. Try this now. Try that. Let's just see if his speed increases a bit, being a little bit more upright. Very strong in there, which is good. You might just find that easier to eat. And what you can do is ponytail food, which is where we have, so if he's sitting like that in a cage, you can get your long stem grass like this with a peg, put elastic bands around the end so it's in, get a really big clump. This is tiny, really big clump and really long. And then using a clip it to the edge of the cage like that. So he may find that easier if it's literally draping like that to access than if it's flat on the ground. Because he'll sit there with his ponytail of food and he'll nibble it, and you'll come back and it'll all be eaten off here. It'll all be gone because he'll eat it one strand at a time. So that's just to assist him rather than him trying to orientate his head because he's struggling with the orientation. So if we support him a little bit like that, it's not a cure, it's not a fix, but it's just a way of making it a bit better, yeah, for him. So that he can then
So there's
Continue.
less pooping and less eating is also the cause of the eyes crusting around.
He should be eating all the time. He's probably more disoriented than anything, and that's having a huge impact. But he's better in that position than without this here. So yeah, I would keep up with the fenbendazole that they've prescribed, but I would consider getting an X-ray. And to be perfectly honest, there are a lot of vets that will do an X-ray at a reasonable price. CT scans and X-rays provide different information to vets, and in some situations, you know, they need to see a CT scan, which is a very expensive scan. But to actually see if this is calcified or not, you could just have a standard X-ray. Yep. And there'd be a way to do that. But it would just give you confirmation that that's what you're dealing with. So I'm going to get a light and we'll have a better look inside that head. So that's how we can sort of make him comfortable. Are you giving him any critical care food to feed? So you can actually mix up critical care food. Have you heard of that?
But I've read about the critical care.
Yeah, so you can mix that up and give it by syringe, and they gollop it down because there's no effort in chewing. Yeah, yeah. Yeah, syringe, so he's wanting the food. Okay, yeah, he can't chew it fast enough, so he's not getting enough food. And he will like having some critical care. I've got a video on how you can make it. You can create it from your own food combinations that you give them. Predominantly it's hay that goes in the blender, so use your coffee grinder or blender to really blend it up. And predominantly you can do that, but you can also buy so many of them over the counter now, which are really, really useful. I might go and mix one up and then we'll see how he goes with it, and he'll take it while he's here. So yeah. He's eating it all. He's looking lovely and round. He's taking it all. Yeah. So you might have to actually just feed them separately, like with a little pad, and he's got his pile of food. Keep him separate with his pile of food, and then let them go back. So at least one meal a day, you can sort of see, oh, and make the meals the same, and you'll see his will be gone, and his might be quarter gone, and that's the difference. So because he's eating slow, but if he gets longer, he can then eat it. Yeah. Oh, just for an hour. Just for an hour while he eats dinner. Yeah, just a dinner, not for good. Yeah, just so that he doesn't eat it all off him, and he gets a chance to eat as much as he can. Yeah. And you can also do the critical care in a bowl, which they can lap. And if he loves that, he will lap it up. His buddy will too, so you'll end up making twice as much. But that's an easy way to do it. Yeah. So I'll go and get one of the critical cares mixed up, and let's give him some syringe for eating. Super, super cute. Yeah. Choc, it's not good. Yeah.
It's so sad. It's breaking my heart. It's breaking our hearts.
Yeah, it is. But yeah, look, I think, you know, to be honest, the guess with parasite is not really accurate. But, you know, he had the period where he got a bit better and he's plummeted again. So, you know, maybe. We don't see that sort of impact on guinea pigs that we do on other animals. Like there's a thing called rat lung well, it's not a virus, it's a parasite, but typically it's found in snails and slugs. And what happens is birds like kookaburras will pick one up and eat it, and they then literally, we find them on the ground. They're not really able to fly, they're out of sorts, but the meninges of the brain, which is the outer layer of the brain, is that right? Have I got that right? Meninges? I hope I'm calling it the right thing. Anyway, the outer layer of the brain is actually inflamed by this parasite, and that's what happens, and they need to be euthanized because it's, in that case, it's not good. But we do not see that parasite in these animals, but fenbendazole is what we actually treat it with in the others. But with wildlife, we don't treat it; they're euthanized. It's just not successful. So it's an interesting area. Have I got that right? Meninges of the brain? I have to look it up.
Is it like meningitis?
Yeah, it must be meninges. It's the outer layer of the brain. Meninges. My brain is frazzled at the moment, so yeah.
Can you advise with the, like, so I noticed he's been
Underneath, yeah, because he's on his side. So the food, imagine if you were eating this way, the moisture from your glands tends to go down, and then it's easy to come out the side of your mouth. So that's what's happening. So the more we can keep him upright like this, the better in just assisting him to get a bit more comfortable. Yeah, he did in that position. Yeah, so it's under one paw. It's sort of elevating that side of his body, and he's a little bit more comfortable in it. So something that height and size, yeah, and try and mimic that, so that he's a little bit more comfy. It's what he's trying to seek in the cage. Yeah.
If it's a calcified bulla,
There's nothing. Nothing. Yeah, nothing. And in some ways,
as long as he's not in pain.
well, the problem is we can't assess the level of disorientation and how much that is affecting him. So we look at things like weight gain, weight loss, if he's starting to deteriorate, if he's not able to manage well within a cage, and there is an imbalance to how he would feel, because as prey animals they feel very vulnerable if they're not able to run and hide and do the things they can do, even though he knows you and you're looking after him. And I'm not suggesting immediate euthanasia at all, but it is, if it is the calcified bulla, then yes, that's where it goes. So, but he's a case of that. So yeah.
Even if he does confirm that's the case, you can also try to see he's going up.
Yes.
And just leave it as
Yeah. It won't improve, but it will just get worse. Yeah. So, and they're really hard decisions when you've got that with an animal. I know, when they're literally,
Shed a few tears
and
already.
I know, and you're looking after them. And I saw his buddy just over the top of him, and he's, oh, that's okay, thank you. Yeah,
be
and
rushing
he's-
discharge. That's exactly what I was to that all of the medical.
yes, when is right, when is not. So we've got some videos on grief on the channel that you can also look at, that sort of help with discussions around that. But it's a really difficult situation. It's almost like he can't see as well at the moment. I don't think his sight is very good, and because he's disorientated.
His
Yeah.
reaction is not as big anymore.
No, I don't think he sees it. So if I do this, in fact, if you clap your hands together, he's not even hearing. So he's deaf at the moment. So you make a really loud noise over him. Good. It's not reacting.
Yeah, because when he does the vacuum in the area,
Yeah.
it's not reacting
No.
while he runs away.
No, so he's not seeing, he's not hearing, he's lost his sight, he's lost his hearing, he's sort of upside down. This isn't an age thing. I really do think this is calcified bulla. I think.
This is way too young.
Well, yeah, and it's just the impact of it on him is, a parasite does not affect hearing and eyesight. It will affect either the entirety of your health system, or not take out different areas. So no. So he's got he's got some serious issues there, and I think if we had an X-ray, it would confirm that. I think probably what you may have seen 2 weeks ago when he picked up a bit was maybe the extra care and attention he was being given. Maybe the fembendazole helped. I'm not sure. I sort of question that heavily. Yeah.
It's the general care.
I think it's the general care, feeding. He's got more food. He's feeling a little bit more able to cope.
After giving him that medicine for, say, 2 days straight away, we saw the difference. The
Right.
head tilt was gone. So we thought, okay, he's picking up, he's eating well, he jumps on the hay tray.
See, if he was doing that, that's fantastic.
Yeah, and then last Wednesday, suddenly during dinner, we were giving him out food.
Yeah.
Noticed everything was
Yeah.
fine with Choc. It's just
Well, they can. I mean, another thing that when guinea pigs have trauma to their spine, for example, they can have interspatial differences between the spinal bones that cause disruption to the signals in how they move, and they don't move as well. But fenbendazole is for parasites. It's got nothing to do with the spine, and he hasn't had a known accident. So we've, you know, it's like looking down the pathway of what this can be. Typically with, you know, spinal type injuries, we see, there we go, he's grooming himself so he feels a little bit better. Good boy.
See, this
Yeah.
first time again I saw him.
Yeah. And if we were looking at trauma, like a spinal injury or basically, you know, yeah, he is. I've got my hand here, he's leaning on me there. So I'm just assisting him how he needs it. And yeah, I just wanted to find more grass. Some more grass. Have this one. This one? Yeah. That one? There it is. Come on. So if that's where meloxicam is helpful, because it's an anti-inflammatory and can help with that and help improve signaling. So
Is that something we can get
from the vet. Yeah, from the vet. So again, from the vet. So
Can we actually go to the vet and say, like, well, have you checked whatever, and we'll just ask for that one?
yes, you could ask for meloxicam and say, look, you've been to see me, and you know, there's a consideration or question around inflammation and pain. Meloxicam isn't going to hurt at this stage, it's only going to help. It's not also going to cure. If we were dealing with a spinal issue, then it would help settle things a little bit more, which would explain why he then got better and then didn't. He may be re-injured that, or it's not stable. But you know, you would only look at that if he's had an accident of some kind, which he hasn't. So yeah, so I think supporting him right now is the best thing, and then considering potentially an x-ray just to rule out the bulla, and you know, positioning like this, like trying to help where you're elevating that side of his body so he's more orientated, just helping him regain. He's definitely not hearing. It's just showing how he's deaf.
Oh, he's deaf.
And blind, yeah.
I'm blind.
Yeah.
Well,
But he wasn't before.
oh.
So this has happened. So if we do this.
Can I take
See?
it maybe for the lady
Yes.
here?
Oh, definitely. Yes, you can. We'll just unclick that.
I'll let you do that.
There we go. Yeah, you can. Yeah. So yeah, that's why he's struggling with that. So, but yeah, he's definitely not seeing. Yeah, that's the drill. Yeah, but that's okay. You can even put if you make one of these rolls, put a piece of paper towel on that you can then take off. So just paper toweling, and that will catch his drool. So he was there eating, you can see his little drool area on there. Sorry?
Work around the schedule.
Yeah, he's pretty frail. So I would be using, this is a V technique, but on his arm. And it's just giving him support on that side of his body, and you can see how it's affecting him. He was cleaning himself a minute ago, so he's a bit happier with that, as long as he's got food in front of him. So if we had a little ponytail of food right here, like this, you would actually see him, he'll pick and choose what he wants.
So now I'm starting to think maybe the hay run is better now than for him.
No, I'd have it still on the ground so he can just in front. It just helps sometimes if it's elevated. I don't think he managed that real well when he tried just then.
Yeah.
So, yeah. But he's using this under his right side. So that's about the right shape. Yeah, maybe even a little higher. But what you can do is, again, you can actually attach that to him with vet wrap, which is that open. So what you can do,
And they wouldn't try to wipe.
no. When they're like this in this state, no. So you do this sort of thing. I'll show you. People on YouTube can watch as well. So we do this vet wrap. That's quite a big strap. Normally I'd halve that, but literally we do this. I've split that down one side. Okay. Now, if this were, can I cut this in half?
Yeah, yeah.
I'm cutting a cloth, but it was around there. So you've got the V shape that you can create for him. I should do it all the way. It's not working, is it? Art and craft, everyone. Nearly there. I've got scissors too. Positioning it where I want it. Then that one's going under his tummy, and where that divider is, I've got one in front of his leg, see, and one behind. So that comes over, that comes, so we're literally positioning it. Exactly. So what we're doing is this. Okay, it is, yeah. You can actually position it. Stick on itself. There you go. And that way. Same thing. Okay. So he actually has that with him now. I've done it well, have I? Stick on there.
You can just use anything else. It's not dangerous for him to buy.
No, this is vet wrap. It's the only thing I'd recommend you use.
Oh, it actually sticks. Oh.
Yeah, it sticks on itself. That one's having trouble. So I would get a little bit of stick tape and stick it there. But what that's done is actually position that for him. So as he moves about, he's now got that under his shoulder padding. So it positions it. Okay.
Then whenever he feels like he's just gonna look for that.
Yeah. So I've got some stick tape here. Want to keep an eye on him for me? Just keep an eye on him. But that's how you can strap a pad underneath, and then he'll feel a little bit more comfortable with that. If he starts trying to struggle with it, then you take it off. But that can, oh, look at that tape. No tape wants to stick. What is this? What? Nothing's sticking today. Why not? Why not? Hey, is that better for you? Want some of this? Want some? Want some? Just thinking about it. Want some of this? Want some grass? What do you think? Try with this.
So we'll just
Try with
finish
that.
off the.
Can you believe that? It's coming off again. I would finish it.
Yeah, it's just up
Yeah.
to this Wednesday.
Yeah, I would finish it. Yeah, meloxicam. Meloxicam. I'll try for him. Where do you live? Croydon? Okay. It's determined not to stick, isn't it? Yeah. But that's how you position it with him. Yeah. What are you doing, that little dude? very, very soft, very, very stretchy. You never ever put this tight on them. But yeah, you just want it soft to support that for him. So there's loads of movement in there. Yeah. For him. But yeah, he's, yeah, I tend to think that is what is going on. So yeah, it's not good, not good. I know, Choc, it's not good. Well, it's not a contagious thing. They don't know why it occurs. They don't know what the reasoning is for it. Yeah, it just happens. So he's going to be safe. He won't get it. Yeah. It's just really a case of nursing him through this. You could give him added vitamin C as well. That would help. That would help him. Just look, he eats well. It's just a case of getting enough food. I'll go and mix up some of the critical care so you can syringe feed him that. And just show him, like, he will gulp that down because it's easy to eat. And then with this, you can take that piece with you. Try him at home because he's going to move around in his cage while he's traveling. But you can use that layout, so cut it the same shape, and then you'll see how it fits to help him. So yeah, you're a nice little dude. Come here. Do your back nails for you while I've got you. Yeah, but from what he's eating, that's, you know, to be expected. Yeah. So that's okay. Yeah, just, that one's okay down there. Look at the 5-step method that we've got on YouTube because it's so easy when you do it that way. Yeah, these little poopers, because he's only eating such a small amount. Yeah. Come here, little guy. Got one more I need to get. It's right in the inside where you're tilting. Tricky. Under one side, so he's more elevated. Let's pop him down and we'll get him. Chippy. He's eating.
He's like, oh no, it's my turn. Look at this big fella, Chippy. You're gorgeous. Look at you. You're eating twice the food. So he's eating. Yeah, he's eating Choc's food.
That's right.
That's what's going on. He's not mind yet, but he was just nuzzled up to him. It's like, oh, really sad. It's really, really hard when that's the case. So, yeah. Oh, guy.
The weight difference of it.
Oh, huge. Yeah, huge. Yeah. Definitely. Come here, little guy. You are gorgeous. Look at you.
What happened to chocolate? Was it something to do with his genetics?
No, not. Well, they don't think it's genetic.
well, maybe. They just don't know. There's no cure for it. They don't know quite why. If it's, you know, something, it's okay, I'm not hurting you. He says, yes you are. Yes you are. I didn't touch you. I didn't touch it. How about that? How funny is he? You are so funny. Look at you. No, I was just trying to, anything I go near his nail, he's like squeaking. See, look, I'm not, he's moving away. Okay, shall I wrap you up? I think I will. You're so cute. Oh, come on. You just want to be done the special way, don't you? He's so cute. Yeah, he's eating all the food though.
Definitely.
He is having all of it.
Happy.
Yeah, he is happy. He's so sweet. Oh. There, stay there. I know, look at that face. He's like, what the hell? What the hell are you doing to me? Now I've got you.
I'm accepted with this.
You don't need to squeak. No, you don't. He does it every time I do it. Good. He's like, it's okay, no one's hurting you. It's okay. Good, see? There's that worry sound.
He's the one who would try to nibble you when you put your finger below his mouth.
Yeah.
He's that one.
It's got some little spurs there. We'll just take those off, see? Little spur.
Oh, yeah.
His foot. It's alright. Let's cut right back actually. Do you trim those back? Or is he doing it?
Yeah.
There we go. Just take that back. He does, doesn't he? Yeah. It will help him. Yeah. Take a look. Good. You see this one? That one we did. Okay, can I do feet now, mister? So, yeah. Alex.
You asked whether it's no chance.
He's like, he's so cute. Take a photo. You gotta get a photo because you're so cute in this direction. Yeah. Just video of it for a second. You're so cute. You're so cute. It's adorable. Yeah, this one. You can hear him go. He's like, no. Always squeeze first. So here, I'm squeezing on his. He's not pulling back, so I can cut. Because he's very worried about getting hurt. So he's yeah. You're cute. See, I didn't hurt you at all. How's that? Let's go and show YouTube. Come on. YouTube are gonna look at you because you're so cute. Look how cute he is.
Smile. You smile.
Everyone see him on there? Hopefully. Look at him. Is he so cute? He's so adorable, isn't he? This is Chip and Choc.
Chip,
Yeah,
yeah.
this is Chip. Chip, you are so cute. Okay. Chip is eating all of Choc's food, for sure.
He's
Yeah.
having a feast now.
Yeah, he is. So there we go. Now it's done. He's gorgeous. There we go.
That's by the looks of it.
Total
Beautiful.
opposite of Choc now.
Let me go and get Choc some critical care.
I think he had a bit of rice on that.
He will No, you need meloxicam from the vet. What you can do is get hemp, which is it has CBD components in it, which is good as a pain relief. So Swiss have a capsule which is 1,000 IU. You can buy those, and then you pierce the capsule and you can put some of that on his ear. That is a good pain relief as well.
That's over the
That's over the counter. Yeah.
What is it?
So Swiss hemp capsules.
Swiss?
Yeah, Swiss. SUISSE. They're the maker. Yeah. Hemp capsules. We use some stronger ones here, but they're quite reasonable. But if you get those, it's an oil capsule, so you pierce it. One of those will last about 3 days, so you can keep it in cling film in the fridge. But you rub it all over the back of his ear. That's how it's absorbed, and it will help. So definitely.
It works similar to.
Yes. Yes. Yes.
Just trying to read things.
Yeah.
Normally with.
I would try that first in the state that he's in, and then see when the fenbendazole runs out. Make a decision as to, like, if you're going back to the vet or a vet, then get X-ray, just a standard X-ray to see if that bulla is calcified, and meloxicam.
Seeing a vet, it has to be an X-ray event again.
No, it doesn't. No. We know a lot of vets that are not exotic vets, like Michelle at North Richmond Vet is wonderful with guinea pigs. North Richmond Vet. She's fabulous. Fabulous. Normanhurst here, Normanhurst Vet here, Hornsby Vet here. They're all very local, they're all very good, and they've got people who have done extra study. A lot of veterinary practices have an exotic vet there, although they're not an exotic vet practice. So when you find the right vets, they can be very, very good. So any of those, yeah.
It's basically the general vet just saw me.
Okay.
And we just went back to seeing Sonny.
Yeah.
Just basically what's happening was just confirmation of the general vet did during the emergency.
Yeah.
And she just laid on 3 speculations.
Yeah.
The fenbendazole kind of things.
Fenbendazole being used in guinea pigs is really quite unusual, but it is an anti-parasitic that's used for things like rat lung. And
That's exactly what the general vet said.
yeah, it's very abnormal. Yeah, like panicure. There's other things like panicure and different things that can be used for different problems. So it's not to rule out that it can't happen, but when we look at rat lung, it is all about snails and slugs. Well, these guys don't have anything to do with them, but if they've eaten some grass that has a silver trail on it, for example, and the silver trail had rat lung, that is how they can actually end up with a parasite of that nature. So you can't rule it out.
But he's been treated by the
Yeah, he's been but it is a longer term treatment, and he's certainly, like, his sight and his hearing are impacted by whatever is going on. So the animals that I've seen with rat lung, they are grounded. They're usually owls, and they're usually grounded. They can't fly, they can't see, and they're euthanized. So might be worthwhile calling the vet that you had to explain that you saw a pickup and then it's now gone the other way, should that be increased to like 0.5 or 0.4. So to actually see if because it may have made an impact, if that is what we're looking at, then an increase in it may be more effective. So it's worth the phone call. So call them to find out on that. But at the same time, I'd then finish the course, but I'd look at the pain relief, which we've talked about, keeping the pads in place, extra food. We'll get some critical care now, and then see how it works. All right. Yeah.
We're looking around for stuff as well that we can get.
Oh, okay. They're just 8.
8?
I think, yeah. Were they in? Where were they? Is that one here?
Yeah.
Oh, in there. Yeah, just 8.
This one?
8 each. Yeah, no, 8. It's fine.
Do you need
It's fine. I'm just going to check the time. No, that is okay. 2 a.m. Okay. Just But let me go and get some critical care, and you can sit and try giving him that, and then I would go and purchase some, so that you can, or make it yourself, so that you can increase his food intake with that. Because those poops being so tiny is just related to how much food he's eating. He's getting tired and he's not sure where he is and disorientated. So if you can make that easier for him, it will give him more strength as well. So let's try that. I'll go and mix some up for you, and then you can feed him. Okay?
So we send this across with the donation, or we just make it separate?
You can. Yeah, you can. Yeah, just with. Yeah, if you'd like to. That's great. Thank you. Do you have the details? Yeah.
Does it change it?
No, it's nothing changed. No, thank you. Thank you. Let me just, no, that's okay. Let me go and grab some.
Looking forward to this day.
Yeah, he's really a rare case. Yes, it's unusual. Oh, thank you. Yeah. So if you try this with him now, this is Criticare. See if it'll go
So
on.
it's just water.
Just water added to it. See
Okay.
how it? No, it's called Criticare. You buy it just over the counter, but it mixes up to this. So if you go and try him with that, and I might need some tissues. So have you fed him before with a syringe?
Yeah.
You have? Great.
I'll show.
Oh, thank you. That's great. Thanks.
Thank you.
That is a pleasure. It's a pleasure. I think, no, yeah, I'm sorry we can't do more because it's really unusual. Yeah. Thank you. I think, yeah, I have. I think Naomi's next with pepper and cocoa.
Cecilia was here first. She just wants.
Oh, okay, she's just getting her piggy checked. Okay, sure.
Just in case
Yeah,
there is
sure.
an issue.
Oh,
If
yeah,
not,
she
we
can come on over.
option
Yep,
if there
and then
is.
we'll, yeah, no problem. Yeah, come on over. Oh my word. Hi YouTube, I'll be back to see you in a minute. Hi Cecilia, how are you? Sorry, we just had a really
that's
unusual
Yeah,
piggy.
I know.
Yeah. Who's this?
This is Coco.
Coco, hello. Look at you. Super cute. How old? 7? Is that right? No?
I think she was. I got her here.
Okay.
Here in 2021, I think.
Oh, right. Okay. Yep.
Six.
Right. Okay. Yep. And you had an older one
I had
to go with it. Yeah. Okay. So you've lost her.
Yeah.
Hello there.
So I lost the other one.
Yeah.
Middle of Jan,
Yeah.
and then she came down with that the whatever.
Pericarditis.
Yep.
Yeah. So
2 weeks later.
was she put on like cisapride or as a medication?
No, they had to do the what do they call it, the ultrasound thing to extract.
Oh,
the
to
fluid
drain it.
out.
They did it that way. Okay.
And then she was on furosemide for.
Oh, okay. Furosemide. Yeah. Okay.
So she was fine for about a month.
Sorry, cisapride is diuretic. They often combine
Yeah.
the two, but yeah. Okay. Furosemide.
And then I think they, and this morning she was just head bobbing. So it was just kind of monitoring.
She's bright in her eyes.
She does have urine.
Yeah. So she's bright-eyed and well hydrated. She's very quiet in there indeed.
Yeah.
But yeah, it's all clear.
So I think it could just be her normal, but I just thought I'd monitor it to see. That's, the breathing hasn't been completely, it's never been 100%. Completely normal.
Just watching her breath rate there. It's quite shallow. She's shallow breathing. She's not deep breathing. And you can tell shallow breathing guinea pigs just by looking at the pattern on their coat. And she's very shallow in her breath work. When did she have it drained?
February.
Wow, not long ago. Okay.
Which is why I thought it might have been a bit overly optimistic. Trying to get a plan.
Look, she looks good. She is herself. She's breathing shallow. So what you could do is try with, one of the little ones, just because they're not dominant, they're not intimidating. Whereas if you get an older one, bigger one, it could be a little bit more stressful.
She does tend to, she wants to be dominant.
Yeah.
Even with the other one, she can kind of be dominant.
Okay. Kisses, hey? Kisses.
Very affectionate.
Yeah. So, what we could try is that, and just see how she goes. She looks bright and well. So,
Didn't hear anything.
no, nothing, because it's so shallow. It's actually,
All right, that's
she's
something
really
normal.
quiet. It is.
Yeah, so I guess my,
Yeah.
I thought, I know she has the short short and raspy.
Yep. No, there's no
But then
raspiness at all.
sorry.
No.
Yeah, okay.
Yeah.
But then she was head bobbing today. I thought, might be
Okay.
what it's kind of monitor that.
Yeah. No, I think let her meet a friend and then just see how she goes. I mean, with guinea pigs that have got issues like that, they're not going to get too overly active, and if they do, they'll slow down and stop. And she might just be really interactive, so it might be really positive. So yeah, so I would just try. You are so cute. Hello, sweet pie. So she's gorgeous. What's her name again? Coco. Coco, you're very cute. Yeah, so I would try her. Yeah.
Okay.
Yeah, you don't need to worry about anything else with that. And
Yeah, I didn't want to
Yeah.
stress her out.
no, just go slow with it. I'd try something less intimidating, like a youngish one, and just see how that goes. We do have older ones here, so they're around 5.5 to 6.5 if you wanted to look at older ones. So we do, but
And ultimately, I just
Yeah.
didn't want to stress her out.
that's right. So that's why I say put a little one in, just see
Yeah.
if she's looking stressed or not interested or just overdoing it a bit too much. Then she's had a nice day out, and and we can wait. Yeah. One of the things with shallow breathing can actually be fluid coming back, and it can come back very quickly.
Yeah, that's what the vet
And
said.
yeah, well that's what worries me with the shallow breathing. So just to flag that to you.
Yeah. Which
Yeah.
is why I thought I monitor a little bit longer.
Yeah.
It's only been about a month, so
Yeah. I've seen the fluids return within a week. Yeah, so it
be able
can,
to find where it came from.
yeah. Well, the body just produces it.
Week.
Yeah, within a week. It was one particular thyroid girl that, yeah, it was taking like a month to return, then it was drained, then it was 3 weeks, then it was 2 weeks, and it got down to a week.
Yeah.
Within a week, 70 mil
Wow.
was returning. 70 mil. That's huge. It's a huge amount. Yeah, so it is massive. But, yeah, so,
We did discuss that. I said, look, I don't really want to be getting her drained constantly.
yeah.
At that point, we have to assess what
It's quite invasive, yeah, it is. So just check and see. But when you've got shallow breathing happening, that can be an indication because there's less lung space, which is what's impacting it. Yeah,
and when she was head bobbing today, this morning,
yeah,
it's not good.
not good, yeah. So yeah,
Noticed lighter. She doesn't fur on the side.
she's actually got a V pattern. She does, yeah. So yeah,
I know
I
they
just
shave
give
the
her some.
sides for the ultrasound.
Yeah, no, she actually does have. So you can see through here, it goes straight down
can see
there,
that
straight
now.
up there into there. It's like a straight V.
Is that the mite thing?
It is, yeah. So just give her some.
She's due
Give
for a
some.
course.
Yeah,
actually.
just do that now, because yeah, she's just showing the very slightest signs. I didn't want to say that first,
Yeah, I
but yeah,
think what she'll bypass.
yeah. No, she's got a very clear V there. So yeah,
no,
I would
she
just
is-
start
she
that.
is due for
Yeah.
another dose, so
Yeah.
and I know she's been scratching.
Yeah. Well, because she's also older, the time frame that you would normally have for them is shortened because their immunity is compromised.
Yeah.
So it tends to be they need like a little bit less time, but that's all it is. She's lovely. She's gorgeous. You're beautiful. It's a bit of anti-nose.
Sorry, I'm just noticing what now.
No, it's just a shadow.
Is it just a show?
Yeah, it's just a skin. You're cute. She's so cute. Wow. You came from here all that time ago. Hey, it's good to see them being so well loved.
I did notice
So,
you
yeah.
had some lab release.
Yes.
That looks a bit like her.
Oh, okay, yeah. Yeah.
Anything.
No, the babies are actually all out at the moment. So they're in a group somewhere out there. Are they? Yeah. So they're the ones that are left from the lab release on the 3rd. I'm just trying to think, we don't have any just like her. Even in the shelter, in the older ones. But yeah, we have lots. We've got many things. Yeah, so I just, if she wants to see her with a friend today, you can. But, she's got a lot going on.
Yeah.
So, yeah. Alrighty. Here we go, little girl. I'm going to hand you back. Go back in here.
Do you think it'd be better to
There. Go in there.
wait another week?
It's really up to you. I don't think it's going to be to any detriment for her to meet someone. Yeah, it won't be of any detriment at all. But if she's, I can do her nails for
I
her.
find her very difficult. She's got a long quick.
Hi, Ellen. Hello. Yeah, she doesn't like it doing, does she?
And she's got a long quick as well. I think
Yeah.
it's like I said last time, so I find it very difficult.
No. Hey there, can I have a look at them? Yeah. She's like, I'm on to you. I'm just trying to be clever in here, so I don't even disturb you where you're standing. Good. Good. Got it? Good. I'll do this one. Same method. It's where the bend in the nail is. But you gotta give it back to me now. Come on. Can we do this? I'll hold you like this. Is that good? How's that? There's no. I'm trying to do that one. It's this one. Come on. I'm gonna do this one. You go in there. I can get it right there. Just trying to not bother her. Quite a dominant girl, isn't she? She's like, get off, I know what you're doing. Just want the other two. As well. Hands down. You know you've had enough. Let him in. I've had enough.
Okay, we'll just leave that.
Had enough. Come here. I'll do the other method with her. Let's wrap you up. Come here. Have you ever tried this method with her?
I do.
You failed. You're not supposed to fail. Come on. Thank you. Can't have you fail. She's actually standing up on her front paws right now, which makes more room in there. So we're just gonna do. I know. You're gonna have to sit there. Stop. You're all right. Stop. There. Just take this one. When they're super curly, like this, it's quite good. That one you've cut quite well. The pinky one's got a bit of a poop on it. Let's just get that. Okay. Get stuck in the corner. Yeah. Yeah, exactly. No, I'm just trying to scrape it off. Hold on. Let me do this. There, got it. Still these curly wellies. Hold on. Hold on. Hold on. Good. Hold on. Don't panic. Don't panic. She's got two arms out, which is why. Hold on, we're nearly there. We're nearly there. We're nearly there. We're nearly there. We are. Nearly there. Good. That's it. Oh. Ah, all good. All good. There we go. There we go. Right. So there we go. So you can do it like that with her. You got your cutter sack? You got your cutter sack? Yeah, and I'll put her into there. Go. So go over to Suzanne. If you'd like to meet any of them, you can.
Yep.
I would just look at how poops are really healthy. Poops. So yeah, definitely, you know, if you'd like to.
Okay.
From me. All right. Okay.
Thank you.
Cheers, Cecilia. Hi. Oh, hi. Sorry. Yeah.
She's got like a guinea pig. She's got the white guinea pig, and she really wants to adopt the little thing with the one with babies.
Oh, right. Okay. If you go and see Laura up there can help.
Yeah.
Have you ever spoken to her?
No.
Oh, okay.
Yeah.
So, have you been helping her with that?
Yeah, I've been helping them.
Oh, okay.
They've been they're bonding really nice. They were snuggled up
Oh,
now.
awesome.
Yeah.
Awesome. Well done.
Yeah.
Well, if you want to see Suzanne can take care of the details. So, yeah, so if you go over to her, that would be awesome. Thank you so much. Well done, Emily. Cheers. Hi. Come down, Naomi. Come down. I'm good. We're just crazy busy. Come on down.
Catch them again. Have some rest, having a sleep together.
Oh, are they? Right, we'll have to go get them. All right.
I'll just grab a box out of there for you as well.
Yeah.
Because I've got, I actually asked on the community page as well, so I've got tons of veggies and I've got meat and I've
Oh,
got
wow. Okay. Oh, fantastic. Thank you. Thank you. Thank you. That's awesome.
from ones are curling over again.
Yeah, they do. There's
She's
only
just,
one there that needs trimming, which is that little tiny
You
one.
guys actually tricked her, didn't you? And you fed her grass while Mummy cut her nails the other week.
Are you using the wrap method?
I've got the what, sorry?
The wrap method?
Oh no, I just sit on my lap. I find it easier. Usually I get my husband to help and I'll hold her. No, he holds her and I cut them because I know how to do it.
What you need to do, I've been showing people all day this method, but you need a piece of fleece like this. You need a pillow slip, so it's really thin. And you're literally going to
Lucy,
put your piggy,
please.
put your piggy in there,
Yeah.
wrap her up. No, not yet, darling, just don't worry. She's okay.
Lucy, can you be careful?
And then you wrap her like this, and you're going to keep her really secure, and her spine is supported in here. So you
okay.
wrap her in so she's literally really supported. And then what you can do, see this little paw? I could literally just take my time. They're already done, so click, click, click. I can take my time as one person.
I'm glad I've
Doing
done
it.
an alright job.
Yeah. So then to do a foot, she's got to pour out. The trick is not to have any feet out,
Yeah.
like she has. So we'll just try and put her back there for a
Lucy,
minute.
please.
So this little foot here, you can see it's out. I can now take the time I want to trim it down. You haven't got much of an edge on there, so it's only that one which shorten a bit, but it's not really, you know, they look great. So we leave a little bit of white on their feet.
Yeah.
And then if we get this one out, I've got two out now. I know, can I put one away? I'll put one away for you. That's sprinkling, isn't it? Wait.
Good girl, Moo.
She's just struggling because
She
she's
really
got
does not
one
like
foot
having
out.
them done.
No, she's okay.
She's okay because she's wrapped. You know, like we wrap babies when we want them to feel safe, then we wrap guinea pigs too.
That one's not bad at all. We'll just take the little tiny tip off it.
Good girl,
There,
Moo.
that's it. You're really cute. There we go. So if you use that method, you can do it.
Okay.
Yeah.
Easier.
Yeah.
Because we still do it, but yeah. Lucy, stop jumping.
Gorgeous girl.
So you were going to check her eyes.
So sweet.
Do you remember when we came
to
and
see
you
if
said-
she's blind.
Yeah. I mean, if she is, she is, but she manages.
One of the ways that you can check is, I think we checked if she was hearing, didn't we? Yeah.
Lucy.
Let's see if you do a loud clap over her head for me. Just clap loud. Yeah, she can hear. See how she jumped? Because their ears will flap. They instantly flap if they hear a noise. But that's good. It's a simple way to test that your guinea pig can hear. Yeah. In terms of, I'm not going to do that. I'm going to do this.
Wait, baby.
So what I'm going to do, move this out of the way.
I mean, if I put things in, she finds them. I don't know if it's because she can smell it.
I'm just going to put that there.
But she's just eaten a ton of grass, so she might not be interested.
It's probably yeah. It's an easier test.
Yum, yum.
She's very apprehensive at where she walks. I do think she's got eye issues. So she's seeing that. She's reactive to that. I think she's got some light and dark. She's not completely blind. But I really do think she's got a very low vision count, if we can call it that.
But she can live quite happily with it
Yes.
like
Oh,
that.
yes. Yeah, they get to know their enclosures really, really well. And that's why her behaviour
She's still
is
like
what it
when
was.
she goes out in a run and stuff like that, she just does
Yeah.
the usual and she'll do a popcorn in and she'll have a
Yeah.
little zoom around.
So what I'd like you to do is get a high value food. So like she's had loads of grass right now. So grass is, you know, they love grass, but
of course.
right now like a piece of carrot would be high value.
Oh.
Or a piece of corn, something she really, really got the taste for.
She doesn't like
I want you to
carrot, but-
literally, no, but I want to
Yeah.
give you a high value food,
Okay,
something
so
she really likes.
Okay.
I want you to give her a little munch on it and then take it off her. And literally, as I'm doing here, I want you to put it down like here. So she has to do this to
Okay.
go around. And just see if she can see it and follow you
Yeah.
or not.
Lucy,
Yeah.
get down, please.
And that will just sort of test how, you know, how keen. Oh,
If you want to try it,
Yeah.
there's some parsley in the,
Oh,
in
is
the
that?
bag. and she
Okay,
loves
let's go and get that.
parsley.
Let's go and get that. Yeah.
Lucy, can you please
Yeah.
stop jumping off that?
Yeah.
Go ahead. Thank you so much for your
Oh, thank you. No, please stay in touch. Let me know how you're going by Wednesday. Yep. Okay, cheers. Here we go. Let's re-see this. Got it. Now. All right. There we go. So we're going to try her a little bit on this. Look. And she says, oh, that's yummy. You're watching, Naomi? I took it off her. She doesn't know.
Okay.
She liked it. She was instantly on it.
Yeah.
But she doesn't know. She's not looking with her eyes.
Yeah.
She's not. She's literally standing, smelling. She's not looking. She's like, what happened? She's like, where'd it go? Yeah. So her eyesight is not. Oh, careful, sweetie. Her eyesight is not really tip top. So if we give her another little bit again, let's look. See like this. She goes, oh yes, yeah. Now take it off her. Literally, I'm gonna do. You can hear it. I'm gonna do that. She's not even seeing it. She's completely oblivious to what's going on. So, yeah, she has really. I know it's not here with me. It's not here. Where is it? Yeah, where is it? Where's it gone? Make noise. Could it be there? She's wondering what's making that noise. Like, you can tell she's not seeing it. Yeah.
But
So
then
she's-
I
yeah.
suppose she won't have known any difference.
No, she's.
Like that.
Well, some guineas can be born like that, and some guineas can lose their sight as they go along. Like the boy that we've just seen here, Chip and Choc. Sorry, Choc has. He's now blind and deaf. He wasn't that way to begin with. So thank you. Bye. So he's got a really serious issue going on right now, which is creating that. So yeah, so some can lose it as they go. She can't even see. It's right. She's smelling my fingers, and it's right beside her. There she goes. She's on it now. So that's hopefully a great way that you can see what's going on.
Stop it.
Yeah.
Right.
Here we go. Let's do your other piggy. Where's your other piggy?
Where's
Should we
Pepper?
go and get Pepper?
Other than that, do you think she's
really good.
okay?
Yeah.
Good.
Yeah.
She's quite big for
Yeah.
a girl, isn't she?
She's lovely. Yeah, she's lovely. She might be in for ovarian cysts later. Check on those. But she's fine. Yeah. Munching you like a
that,
parsley.
darling?
Yeah, so that's super cute. No, I keep her going as she is, which is great. Yeah. He's awesome.
Big girl. She's cute.
There we go. Let's go and get
She's
Pepper.
definitely settled with Pepper.
Yes, both of them were absolutely out laying down under
Yeah.
the tunnel. So
Lovely, isn't it?
very happy. Yeah. We found you the right buddy.
We did.
Yeah. And she's super, super gorgeous and cute. Yeah.
One
Yeah.
of the ladies, because I posted on the community page last night asking
Yeah.
for people to give us veggies, and you know her, I think, Patricia Bavista, I think she's called. She does a lot of dog
Oh,
rescues and stuff.
okay.
And she said,
Oh,
she's like, I'm so glad you've made our
Oh.
community aware of it.
Oh, thank you. Oh, the box is just fantastic. Thank you so much for your generosity and for everyone who contributed. So Piggies
we
will-
just appreciate what
Piggies
you
will
do
love
as
that.
well.
Oh, thank you. Thank you.
Hey,
Here we go. Let's get.
Pepper and
Come
then
on.
we can go, because
Get it.
Pepper just needs a nails cut.
Go and get it.
Because she's got little sharp claws, hasn't she? She's itching on the grass.
isn't it?
Yeah.
Oh, it is. So when you've got black nails,
Yeah.
the exact same process.
How can you tell? Because you can't see the width.
I'll show you. It's part of the 5 steps.
Because
The most important step.
I only knew how to do the guinea pigs because of the dogs. Because we've got one of our Jack Russells is so light that
Yeah.
she doesn't wear her nails down because she's
Oh,
only
okay.
4.6 kilos.
Yeah.
So I have to cut hers, but they're all white, thank goodness.
Yeah, no, if you... So, we've got her here, okay? We've got her little black nails. It's right where the nail curls over, which is here. If I sort of put my finger on
Yeah.
it, there's not a whole lot to trim off there.
So it's just more
At
because they're
all.
so sharp.
They're sharp, yeah. So, I use little scissors when we're just taking the end
Yeah,
off.
okay.
But the trick is to squeeze. So
Yeah.
when you've grabbed the nail,
Because they
like
move, don't
this,
they, if it's gonna
like this.
be too deep.
yeah, you're literally going to squeeze on their
Yeah.
nail. If they pull away, you don't cut.
Okay.
So that's how we do it. And so literally there's the bend. I'm even going to put my stupid glasses on so
Black
you can
nails.
see
I always struggle.
doubling up, which is, thank goodness YouTube are not looking at this. You are. That's okay. It works really well. It does.
You should get one of those headbands with
does.
the thing on.
Yeah, I've got one with
Magnifying
lights on
glass and
actually.
stuff.
Yeah, I have one with
Oh, you've got it.
lights
What
and
is it? Why have you picked it
things.
up? Well, let it go, please.
But yeah, being able to see is absolutely crucial.
It's a shame we can't get Coco sunglasses.
I know. Yeah. So
She's
just
still
trim them
happy,
back like
so.
that. And the same with this.
Good girl, Bella.
She's such a lucky girl. So squeezing every time. And you can almost see like where the nail becomes it gets sort of thinner.
Yeah, like not so
Yeah.
difficult to cut.
Yeah, but it's
Girls, be careful.
and literally just squeezing will then ensure you never hurt. Oh,
They've picked the bug up.
oh, that's the bug. We have got a huge story to go on to YouTube, which I haven't got to yet, and it's all about a bug.
Oh.
It is, so it's coming. It's coming along with a lot of other things, but it is an amazing story.
Lucy, don't kill it. Oh, is it? As long as it doesn't bite them,
Where's
they're
your foot?
fine.
Little girl, where is your foot? Hold on. There, got it. Come on, tea towel.
You're alright, that's me.
Let's try to get the foot out. Yes, I want
Good
your
girl.
foot. Good. Can I have it? There. So same thing. And I might use these clippers. Same thing. So exactly where it bends, which is
Yeah.
there, but literally squeezing
Yeah.
and cutting. I'm just going to take them off. Oh, those glasses. Good. There. Good.
Good girl. It's from the petal.
Yeah. Sure. There.
Oh, yeah. If there was any that I knew of, I would as well, because, you know, it's nicer to do that. Layla, Lucy.
There we go. We're
Very
done.
much. All done, Missy.
We're done.
You can go
So,
home now.
yeah.
Good girl.
She's super cute. And it was lovely how she chose that day. So
I
it
know.
was.
I'm still like, oh,
I know. She
because
was
I'm
the
still
one.
very sad about the other one.
Oh, I know. She was a close second.
Oh no, I mean the one that died.
Oh, the one that passed away. I'm
But
sorry.
she's a
Yes.
nice
I thought
replacement.
because you had the 2 dark ones, I thought you meant
yeah,
of
no,
the other.
I mean, I would have liked to have taken them off, of course, but
Yeah.
yeah. Would kill me if I went home with 2 guinea pigs.
shelter, yeah. Such a surprise. So, tell me about your little one.
Yeah, so this is baby doll.
Yeah.
And yeah,
Never had a baby doll before.
I was
Like
buying
that.
a baby doll and I thought, oh my gosh, it suits you. So
It
she's
does.
very sweet. So yeah, I noticed on the towel last night she had powdery wee.
Okay.
So I thought maybe.
How old is she?
She's 9.5 wee.
Okay.
So I think I spoke to you yesterday.
Yeah.
I'm Kate. Yeah.
Kate.
Yeah.
Hi.
Good. And she found a best friend.
Oh, excellent. Oh, so this is the new friend. So this is the one that you found in the yard. Or you found
No, I actually got her from Chatsworth.
Oh,
She was
right,
not
okay,
selling,
got
she
you.
was alone, and I
That's it.
couldn't leave in.
That's right. Yeah. So we've had like 3 or 4
bet.
cases of terrible things, but she was on her own. Hello. Yeah. So when they're doing calcium, like I'll put this over her because she'll be sort of settled with something around her. When they're doing, I know. Would you like some grass while you're sitting there? Would you like to nibble at this? So when they're doing calcium type wees, it looks a bit like this shadow here. That's like a stain in the cloth, but it's whiter and seems a little bit more chalky in colouring. That is calcium that's being excreted from the body.
Yeah. I
So-
think that's what it is.
Yeah, with guinea pigs that are so young, that's not actually an issue with her at this stage. So it's nothing indicative of stones or other problems that they get later on, but it can be more about her body showing how it's handling calcium. So, for example, if you give a guinea pig a big piece of kale, it will then excrete white patches like that. But kale is brilliant with nutrients. It's one of the best leaves that you can eat, really. Dandelion leaves are up there as well. They've all got it. Dandelion leaves are exactly the same. So they will excrete white after it because of the calcium being excreted. So what people are really worried about when they talk about calcium is bladder stones. And that occurs later on in life. Like I've never seen a guinea pig under 1.5 years with a bladder stone. So she's way, way too young for that. And they're still trying to get to the bottom of what actually causes bladder stones in guinea pigs and why they create them. So a long time ago, they started saying you can't eat calcium, remove calcium from the diet. Well, you can't do that because it's needed for tooth health, for bone health, for your body needs this. I know you've got to have calcium in your diet. You have to have it. But they've worked out that it's more so the salicylate content of foods that causes the problem, because the calcium basically is is binded because of the salicylates in the body. So things like spinach and parsley are high in salicylates. So they're the foods that you actually avoid a little bit more with guinea pigs. Now, from my own perspective, and I've spoken about this lots in the past, when I've had guinea pigs come in, you are so cute, look at you. So cute. It means she's happy. Happy to groom herself. So when guinea pigs come in, let's say 3 of them arrive in and 1 has a stone, they've all had the same diet, they've all had the same exposure, and we will find 1 has stones, the others don't.
That's what happened to I had a 10-year-old and he had stones.
Okay, yeah.
The other one.
The others didn't, yeah. So that doesn't explain the salicylate link because they've had the same diet. So it means there's some predisposition that they haven't yet worked out, whether that's genetic or otherwise, that hasn't yet been sorted out. So that's sort of the scenario with stones, and we've seen that numerous times. I've had, siblings that are from the same litter come in, and 1 has stones, the others don't, and it's happened numerous times. So same food, same everything, but 1 gets stones, and it's a bit like, I guess if we relate that to how we are, you could have a family and 1 person gets an illness and the others don't. So what is it about that scenario that makes it different? So the salicylate value of food is what they're steering people away from at the moment. Don't give them so much of this, but honestly, don't get caught up in diet. So many people will talk about guinea pig diet and say you can give one leaf of kale this day, 2 pieces of capsicum the next day. It's like, it will drive you crazy because it's just too over the top, and it makes keeping these animals too difficult. And what's yeah, but it's actually not right though. That's the thing, because there's no science behind what these people are saying. So they're saying, oh, you know, give this, and it's like, where's your science to back that?
That's true.
You know, if I'm still seeing guinea pigs come in, and even on that diet, one has got stones and the others don't, it's not working. So I think, you know, you've got to look at the balance between having them as pets and keeping it really real, you know, in the sense that you're giving them great food choices and you're having a great life with them. And if something comes up, then you get on top of it really quick. So
And lots of exercise with this as well, movement.
yeah, definitely. You know, another consideration for stones is actually the foods that they're eating, and there's a lot of discussion around artificial pellets because there's bulking agents in them, and we've spoken about that for years, because they won't eat a lot of wheat and, you know, different things are in it. But thank you. So there's a lot of bulking agents that they won't necessarily have in their ground foraging diet. Yeah, so if we think of these animals as ground foragers, you know, they're on the ground, they eat grasses. And if we're constantly giving them like a piece of apple or trying to think of berries, things that are off the ground, that wouldn't be in their diet every single day. The grass would. It'd be like 90% of their diet. So if we think about what's natural to them, grasses are. And if we think of spinach isn't typically in the grass. Neither is the cultivated vegetables and things we have. They're not found in the grasses everywhere. So I just keep coming back to feeding them grass, as much grass as you can. And I think that
That's
it,
a good
you know,
rule of,
yeah. And I mean, as a general rule though, we get guinea pigs here that do tend to live a long time. So that's interesting. But then I also have, you know, massive numbers here over the lifespan of those guinea pigs, so you can outweigh it by that. But we don't see stones much. It's very rare. They usually come in with them. Our animals haven't had them. So
it's about love as well.
and love life, and we give lots and lots of grass where we can. So yeah, so all the foods that have just come in, they will absolutely devour it and eat it. But we, you know, we're high on grass, so the lawn here, we get them eating grasses where we can.
Yeah,
So
that's awesome.
yeah, so
What's,
super cute.
What's the oldest that you've...
Oh, nearly 11,
Yeah,
and that was
same.
Snowy. Yeah.
I've had 2 nearly 11.
Have you? Oh,
Yeah.
fantastic.
And I just spoil them.
Yep,
Just,
that's just it.
Yeah.
And it's, look, another key thing is variety
yeah.
in their diet. So she has got a little bit of white down there.
Yeah.
So I would just, you know, just keep the variety going for her. She's little, and we'll see where she goes. Snowy was actually just like her. He was a Himalayan Abyssinian. So yeah, so cute. But yeah, he was nearly 11. So just keep doing as you're doing. Variety is a key.
Because I've had her only for a week now.
Oh wow,
So,
okay.
I think she might have only been on hay, or that's all I
Yeah.
saw.
Okay. Yeah.
Sometimes I just don't know.
So she could be having these initial reactions to the new foods you're giving her, and because they're new to her, she won't have been getting that in the pet store. So her body is going, oh, hang on, what's the calcium, and excreting it. So there's a bit of adjustment going on with that.
Oh, okay.
Yeah. So you're doing everything right, and you know you've had guineas live to a long age. So
Yeah. She likes you. You're a guinea pig whisperer.
of course, of course we are. I know what we're doing. Yeah, she's super, super cute. There you go. I'll hand her back to you.
That's good to know she's okay and
Yeah, she is.
she's a happy little thing.
Yeah, it's a really good discussion though, and it's an interesting area. And there'll be more, you know, as things progress, there will be more and more information come out on it. But yeah, I don't really fall into the salicylate thing, other than if you imagine guinea pigs on grass, would they really find spinach a lot?
Yeah.
So, because guinea pigs don't actually exist in the wild, live in the wild anywhere. Only, yeah. No,
Like Peruvian sort of.
they are from Peru. They are from Peru, and no, they're not wild. They were domesticated over 3,000 years ago by the Incas. So they were domesticated for the purpose of food and for pets. That's why they kept them around. So when we see, and we've actually got a few areas where we're trying to catch guinea pigs at the moment, but when we see them in the bush, or they're not living there, someone has dumped them, and it's awful. And here in Australia in particular, we have so many predators, from snakes, lizards, birds, you name it, cats. They're a predator to them. They will catch them eventually. They've got to notice them first. So if it's just one going into the bush, it doesn't get noticed as much. But if they've dumped 6 or 7, they get noticed. Yeah, and the colouring, all those things. Yeah. So it's just a matter of time till that happens. But where they survive in Peru, they're actually around people, because they also have predators. They have foxes and other things around, snakes around, but they have them in around the housing. Like I've seen stories where they grab them and pick them up, and it's not very nice, but they live in and around the house structure, and people are there. So animals like foxes aren't going to walk in and get a guinea pig because people are there. So they've got semi-protection. If there were no people around, no infrastructure, then they wouldn't survive as well. So they'd be preyed on. So that's how it
I
works.
didn't know that they weren't just for some reason. I just thought, oh, they're wild in Peru.
No, they're not. No. No, so they definitely roam, and guinea pigs do. When we've done large rescue groups, we'll see them gather into little areas within the layout of, like, if it's a house or a home or a property. We've seen them go across 8 properties because they literally will expand to that. But there's so many factors. Like even in winter, they go into and you've got reptiles here that go into a state called torpor, where they're actually sleeping a lot of the time. They're not hunting. So populations where guinea pigs are in someone's backyard uncontrolled, they go up in wintertime, in the cooler months. That's because the other animals are not preying on them. So then you find in summertime, it actually goes the other way. They come down because they're being preyed on more. So this is it's a horrible cycle, but it's what we see, and it's how it fits in with things. So yeah. 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 Yeah.
To do with animal tourism and all these horrible things as well, where they just think they're getting old. Just, I don't know.
Yeah. Yeah, we have some. My phone. I was just looking for my phone because it's got some. Alini had it.
Oh, your phone?
Yeah, and I was going to show you some photos of ones in the bush that we're working with at the moment. So
How do you catch them?
trap them. You have to trap them.
Okay.
Yeah.
I was going to say you just run around and...
No. So I was going to show you some photos, but yeah, my phone's not here. So it's lovely to meet you, Kate.
Yeah, nice to meet you too.
Yeah,
I've been
and-
on the
yeah.
Instagram. Are you on Instagram?
Yes, on Instagram.
Oh,
Yes.
okay. 'Cause I'm
On there as well.
Facebook,
I'm
so-
not really good at using it. I'm terrible at checking it, but I am. Yeah. Yeah. So I'm trying to do better. Sorry? I can take a little look. Yeah. And is she being ivermected? Oh, thank you. Oh, that's been done with Suzanne. Oh, thank you. Thank you. How are you doing? You okay, Jessica? This is Alini. Oh, here she is. Okay, I was going to show you this photo. I'll see if I can find it.
Are you recording?
I am on YouTube live.
Oh, sorry.
That's all right. Your mum has just asked, are you okay to be here till 5? Is that all right?
Does she want me to stay here till 5?
Your mum?
Yeah.
Yeah, she just texted.
Oh, yeah, it's fine.
Is that okay? Yeah. She just said that they're moving some furniture and she'll arrange. So she said, can you stay till 5?
Yeah, I can.
Yeah? Okay. Okay. I've just got a million messages that have popped up. Give me a second. that okay? You'll be here for pack down. Let me just check this photo. Here we go. Alright, these are guinea pigs. These are guinea pigs here, currently at large. And YouTube can hopefully see that. So they're currently running around. Just one of the groups. So that's one of the groups there. But they're trying to catch those. So yeah.
How do they catch them?
Just with traps.
Do they set
Yeah.
up just a turn trap and then they go into that?
Yeah, we use traps to do that. But yeah, one has been caught already and gave birth 24 hours ago to a single baby. Which, yeah, single. We call them pups when they're babies. But yeah, that little one would have been preyed upon because they're so vulnerable. The mum can run, but the pup has no chance. So yeah. But anyway, just had one. Yeah, she's only so little herself, and she had one. Well, she's really young, but yeah. No, she's not. No, Suzanne's looking after her. So, yeah. She'll be on the group though. If you do, are you on Facebook or no?
My mum is.
Oh, okay. So your mum could join the group, and then she could see the story on her in there.
that's so cool.
Yeah, so she's there. Awesome. Let's check this little one over. She's so cute. Little no name. Hello. Hello. You are adorable. Hi. You're looking gorgeous. Yeah. You're super cute. You're gorgeous. Oh, she's beautiful.
She's definitely a girl.
She is definitely a girl. Oh no, we make sure of all of it. No, nothing like that. No, and she's out of the laboratory on the 3rd of February is when she came out. So you can make that her birthday, or I don't know, you can make one before that. So,
Thank you so much.
it's lovely to see you, Kate. Yeah, come up in a few months' time when they're bigger, and we can check in again, see how they're going. Keep an eye on the calcium, but it's no issue at the moment. It's probably more the adjustment. And, yeah. Awesome. Cheers. Take care. Bye. Hello. I have no idea. We are so far behind. I know. Sheridan is next. Sheridan, yeah. I don't know. Sheridan's got peanut and buster. Hi. Hello, how are you? I'm good.
I do have peanut
She's
as
got
well.
peanut and buster.
Buster's
Right. So is it Buster that had the leg issue?
No, that was peanut.
That was
He's doing
peanut.
amazing.
Great.
But I still.
So we sorted him out. Awesome.
Yeah.
Good.
I think he's doing alright.
Yeah. Okay. What's
But-
going on with?
So with him, I saw
Yeah.
you like a few months ago.
Yep.
Did his teeth.
Yes.
He had a tool.
Yes.
And then you said bring it back just to check the teeth again.
Yes,
So
okay.
I would like to just see where his teeth
See
are.
where his teeth are at.
Because
Okay.
he does seem to be eating really well.
Okay. Yeah.
But he itches a lot, and I know
Ah. Okay.
fungal bugs.
Yes. Yeah.
And I did see some videos where
Yep.
they clean out his ears. So I have still got some meloxicam. I
Okay.
don't know if I'm doing it right though.
Yep.
I just wanted
Let's check him
to
all
see
over.
where is that? And he's
Let's-
a bit crusty underneath.
Let's have a look at him all
And
over.
I just want to know how to manage it.
Let me put gloves on.
And for a while, he seemed really slowing down, hardly moving much. In the last few days, he's kind of running around.
Has he lost any weight or anything?
His weight's good.
Okay.
He's eating well, and he has a constant wheeze, which he's had since I got him.
Yep.
I forgot to mention that to you because he's had all his old stuff.
Okay. Yeah.
But no, I'm still this.
Hello. So this is Buster.
This is Buster.
Buster. Come here, Buster. Hi. Look at you, big fella. He's got a respiratory infection.
He's had that wheeze for like months.
Yeah. This really sounds. So, what antibiotic was he on?
Well,
Is he still on it?
no, they gave him one. He immediately reacted and stopped eating.
Yeah.
And then I brought him to you after that.
Yeah.
And then you said, like, you didn't think he was in any pain, so we
Yeah.
didn't give him anything.
Yep.
And then,
Yeah, it's really strong now.
and then I went to another vet, like, and then they said they gave him penicillin, and I think that's what
Oh, that's not great. Yeah.
He said
Okay.
no, so I stopped that.
Yeah.
So I just, so you think he's got an infection?
He's definitely got a respiratory infection. Yeah.
But yeah, he seems to react.
When you say react, what does he do to react?
Stops eating. Like stops eating completely. Eyes. Has diarrhea. So that was one starting with E.
Enritril?
Yeah, that one.
Yeah.
And then there was a third one I tried.
Yeah. Bactrim, Septrim,
Cetrin.
Flagyl.
Because I said I don't want the penicillin, so they wrote me script for something else.
Yeah.
Maybe
He needs to go back on it for sure.
okay.
Yeah.
So
How long did they put him on it when he stopped eating?
the next day.
Really?
So I stopped taking it. I stopped giving it to him straight away. I stopped doing it straight away.
Yeah.
And then I think I saw you, and then
Yeah.
then I thought they were treating it for dental stuff. But he said it doesn't have dental disease. That's not how they treat it.
Yeah.
So yeah. Then he only had the one respiratory.
Yeah.
And then the other one, I think I again saw you on TV.
Yeah.
But I can try the current one I've got. But he's like completely eating every day.
His tummy's good. Yes, yeah. He's got a big hard tummy in the centre, just checking that. So, yeah. Okay, it's just distressing him too much in that position. He's got pretty much like a pneumonia on board. He does. He's got a real crackle there. So he does need to go onto antibiotics straight away. That's the only thing going to get on top of that.
Yeah, because I've taken him twice to vets and asked them to listen to his chest.
Yeah.
And they've said it's fine.
There's no chance.
Yeah, that's why I'm trying. I just remembered that. Like I've
Yeah.
gone and said, has he got a lung infection? They
Yeah.
said no.
No, he does. He does. He absolutely has a respiratory infection. Yeah, he does. That even distresses him, turning him up. I was going to look at his bottom, but it's distressing him too much.
I'm trying to look at his bottom because
Yeah, no,
I feel
it's
things.
yeah, it's distressing him too much. Yeah,
And that's
because he's
of the infection.
yes,
Right, okay.
yeah. So he's definitely got a respiratory infection on board. I can hear him from here. The guy.
But he's been making that sound basically since I got him, which is why I took him to the vets twice.
Yeah, but he wasn't like this last time here.
Well, he was not constantly.
Not like this,
not
yeah.
constantly, yeah, it would happen at night sometimes.
Yeah, that's what you mentioned before, and when I listened, he couldn't hear it. But this is like, yeah, this is like he's totally got it right now. So it sounds to me like, and we get some guinea pigs that do have repeated respiratory infections, as with urinary tract infections, but a lot of it can be related to things like humidity within their housing. And for him, like when we think of the hot days we've had, where are they housed? Where do you have
In my
them?
house, and I've been blasting the aircon
Yeah.
24/7, like the biggest bill because of them. Like
Yeah.
I don't want them to be uncomfortable because he suffered so much during the first hot day we had.
Yes,
Like I could see how much it impacted him.
it was
So
stressing him, yeah.
I've had the aircon running
Yeah.
non-stop all summer.
Okay, yeah.
25 degrees. And yeah, and only at night I turn it off and have the fan and the air coming in.
Right.
So I don't know if that deals with humidity.
So have you got the aircon, have you got the one that goes out the window and extracts out the window, or is it a built-in one?
It's the one that goes out the window.
Right, okay. Because with those, you can get an increased humidity because they don't extract water out of the air. They often have a mode setting, but they only have that on, not the aircon mode on. Yeah, but you can't, the ones I've seen, you can't have both modes on at once.
Big Panasonic.
Yeah, you'd have to check. You'd have to check it out. But I think your issue with him is going to be humidity related. And when you get hotter weather, the things that create humidity are, for example, if his cage was a little bit damp, like if you clean once a week, okay, yeah. No, that's okay.
So you never wear nothing.
Yeah, so a lot of people sort of, because we're on YouTube as well, a lot of people will wonder how humidity can result. And one of the things is if there's any urine content in the cage, the warmer temperatures makes that rise and it's more humid. So if cages are not absolutely dry, then that can cause a problem. So, you know, for people who would clean a cage once a week, which is to be expected, you know, clean once a week, which is fine. Indoor ones you clean way more, but like, you know, shavings and for people who have hutches and things, once a week is fine. But towards the end of that week, if they get hot weather, just know that that humidity factor is more. So other things that increase it are like plastic. So if they have any hide that is in plastic, that can cause it. With fans like this, he's right in the fan at the moment, which I'll just put that across him there. But having direct fan on them, you can actually transmit colds to guinea pigs. Like that can
I
happen.
haven't got a cold.
No.
I just mean like made him too cold.
Yeah, if that's on him the whole time, yeah. But we don't want them in a breeze. We want air circulate. Like this fan is actually here, sort of right here. I would have it, you know, aimed. So it's circulating the air in the room.
So have a dehumidifier, but it does put air into, you know how
hot,
they make it
exactly,
hot?
yeah. That's why the air cons don't run both settings at once. It's something to do with that, which is really infuriating because it puts more, when you're using the air con, it actually increases the humidity. Yeah.
But I've actually probably made it.
No, I think the humidity is a factor. So how do you deal with humidity? Okay. Dehumidifiers raise the temperature, but another one is actually it sounds really strange, but it's actually a lump of salt.
Oh, yeah.
Just get a lump of salt in a bowl, it absorbs it. Just have that sitting in the room right near them.
Yep.
Because it really does take the moisture out of the air.
And there's absorber crystals.
Yes.
But I could just use salt.
Yeah,
Okay.
salt, get a lump of salt. Just literally do that to decrease the humidity. And then make sure the breeze isn't directly on him. Make sure there's no plastic that he likes to hide in under. If it's a plastic hide, take those out. Make sure they're wooden, breathable structures. You know, even a cardboard structure would offer better breathability than the plastic in this situation. And he definitely needs to be on an antibiotic. So yeah.
Can you clean his ears again?
Yeah, just then.
Like there's a lot of build-up.
Yeah.
Is that, do you think there's fungus?
No, that's normal. That's normal. Yeah.
So that's
Yeah.
not the problem.
No, that's normal. That's a normal
And you
normal
don't
wipe
feel
down.
like his back's, he's not got any fungal. 'Cause
No,
it's itching a lot.
I couldn't really look down there because it panicked him going upside down, which is
Someone suggested that
or not having enough with the antiparasitic. So you can apply it again. You can do that.
the malaseb.
Yeah.
And do you
No, the ivermectin. Are you
yeah,
applying
I do.
ivermectin? Yeah. So you can do that. Can I have another look here, little fella? Let's see if I do it this way carefully. Good boy. Yeah. This is indicative. See how he's got hair loss there? He's getting thinned hair. He's sitting in the one place.
Yeah.
So he's literally sitting in one spot. So what happens is you can see what he's just produced while he's been sitting there. Yeah, but he's also urinating. And his body temperature is warming it up. Then he's got humidity and he's breathing it in.
Yeah. Even
So-
though you change it once a day, during
Exactly.
the day it's building up.
Exactly, yeah.
Okay. And
So-
then he's breathing that in.
He's breathing that in, yeah. And if he's under any sort of a hide, it's around him. It's not sort of going out and
He's
around.
sitting in one spot because of the lung infection.
Yeah, because if you've got pneumonia, you're not going to want to move around a lot. So it's like catch-22. You want him in a situation like I've got him now. No direct air vent on him, but circulated air and food accessible to him where it's a comfortable temperature, so that he can't have anything like humidity build up around him. Does that make sense? Yeah.
Maybe
And that will-
move him myself, like he puts himself in a spot and stays there.
Yeah, I would take him out. I'd move him. I'd put him somewhere else, and I'd remove that spot. If it was a hidey that he was under a plastic one, I'd get rid of it. I'd have something else.
He's in car, they're in car.
Yeah. Okay, is there any moisture in the cardboard? Yeah, because where they go in, if the bottom of the cardboard, like,
Well, no,
cut,
it's just it's
you're just using the overs
cut it out.
and cut it out the bottom.
Cut out
Good.
holes in it.
Good. Yeah, because some people let them go in there, and of course they're urinating, and the cardboard's soggy. Like, nah,
It
no.
was just open.
Yeah, great. Okay, so just make sure.
Like cut holes in it.
Yeah, make sure there's no moisture in that as well. And yeah, we just want a bit more airflow around him, but he definitely has to have
Okay, so
an antibiotic.
give him the antibiotics that I've got at home tonight,
Yep.
maybe, because it's maybe the last one I haven't tried.
Yep. I would definitely give it to him. What have you got at home?
I think it's one with the S.
Septron? Good. Yeah, I would go right for that.
And there's a dose on it.
Yeah, you can give him, he's a bigger boy, I'd actually give him 0.3 of Septrum to start, and then I'd go 0.2 in the morning, 0.2 at night. So just to start, I'd do 0.3. He's more than a kilo. He's about 1.2. Okay, there you go.
He's
So
being stable.
I'm pretty good at picking them up, and I'm like, yeah, he's about a 1 point. Okay, so you could easily give him, yeah, you could easily give him 2.5. Do 2.5.
2.5 morning.
Yeah, yeah.
0.3 to start with.
0.3 or 0.3, 0.5, which is fine. No, just I would look at giving him, making sure he's got lots of his treats. I'd also be weighing him every day.
And should I be using probiotics or those kinds of things?
Yeah, you can, but the thing with probiotics is that it's the gut flora,
Yeah.
and antibiotics are knocking them out, probiotics are putting them back in. So if you do want to do that, you can do it at the end of the course of
Oh, okay.
antibiotics. You can actually do that, because we're only talking about a 2-week window maximum. So he's pretty serious with his respiratory at the moment. So I'd say, you know,
Oh, you've got to give him prebiotics.
no, people get so caught up in things, and then you'll hear you should give that in the morning, you should give this halfway through the day. Your body's going up, down, up, down, up, down with, and it doesn't hurt. You can do it that way.
Give him a critical care.
Yes, definitely. Yes. So I want you to weigh him every day.
So make sure he's not losing weight.
Yes,
Yeah.
monitor him so he's getting enough food, getting enough rest. The environment is absolutely key for managing a respiratory infection.
The only thing I can think of is it will get the aircon, so hopefully it's cooled down.
Yeah, and then at night, do you turn it off at night? Yeah, so he's got a,
Open windows and
Right.
everything, so the air's much cooler at night.
okay, because the other thing at night is that it can go the other way. It can actually get really cold at like 3-4 in the morning.
Yes.
Right now,
Yes.
I'm under my
Well,
blankets
usually
right
I
now.
wake up to Dolly and I come out and
Yeah.
shut all the doors and everything. I do
Exactly.
worry about that. Like,
Yeah, so make sure that he's got fluffy stuff to go into. Maybe put it in at the end of the day, so he can snuggle into there and be warm, because he's juggling like the equivalent of a pneumonia that we would have. So temperatures are key. You want to keep it as stable as possible. If he were, if we were in autumn or winter, I'd say put a heat pack on in there so he can go to it and snuggle up to it. But he doesn't need that now. If he's got enough fluffy, warm things in there, he'll be okay. So yeah, and he's warm enough. He's not stopped thermoregulating or anything. Sorry?
does he seem to have a temperature?
Nope.
I mean, he's managing so well though.
His temperature. Let me take my hands out so I can actually feel him. He is. No, he does feel warm. He is warm. He's definitely warm.
Right, so if
Yeah.
you don't want his too,
No, he definitely, no, he's eating fine. So let's leave. It's stressing him out even to try and look at his bottom. It's stressing him. Yeah, the respiratory, that can set off. We don't want to do that. But he is warm, and just telling the temperature with the guinea pig, they're virtually the same temperatures as us. But if you grab their ears between your fingers, you can feel that skin, and he feels hot to what I am. So I know he has a temperature.
Should I be giving him the painkillers?
No, antibiotic. You could actually, it wouldn't hurt to give him a painkiller. Yeah, it wouldn't hurt to give it to him. It really wouldn't, because he's a nasty pneumonia is not great. But he needs antibiotics. That's the thing that he really needs.
Alright, hopefully.
Yeah.
So 2 weeks.
Let's go the following week. Go for 1 week. It's going to take at least 2 weeks to get on top of it. But run for 1 week, and then let's talk. You can give me a call on him and see what you're hearing. Typically with guineas we give a 7-day course, but when they've got pneumonia, which this is, I can guarantee if you scanned his lungs there'd be shadowing in the lungs, that he needs super careful care
So maybe
at
he's
the
had,
moment.
maybe there was irritation, but now because of the humidity and all that,
It's just
developed.
increased again, yeah. He's sort of going up and down depending on, because he's probably, his immunity's kicking in and then he's winning a bit and losing a bit and winning a bit. Yeah,
It's really healthy.
yeah, he does. He's a great weight. You're really gorgeous. You're gorgeous. But yeah, he has a really serious respiratory infection, so he's definitely got to go on to that.
Yep.
And within 24 hours is when you'll actually see a change when they're on antibiotics. So you should see a little bit less of a noise. He's very noisy in his chest. A little bit less of a noise, not gone, but within 24 hours. If you're not, he may need Enritrol. So he may need a different antibiotic.
Check what I've got.
So,
So 3 meals tonight.
yeah,
Sorry,
3.5. I do 3.5 and 2.5. So 3.5 when you get back.
0.3.
Yes, correct.
0.3,
Yeah.
0.5.
Yes,
And then in the morning, 0.2, 0.5.
yeah,
And then in the night.
0.25. Yeah.
Yep.
So yeah, 0.25. So 0.35 and 0.25. He can easily tolerate that,
Twice
and
a day.
twice a day.
Yep.
Yeah.
Okay, got that.
So how far is home from here now? Oh, okay. Yeah, 2 hours. Yeah, yeah. So no, you need to.
Yeah, I'm going to
Oh, so you're
Central
travelling
Coast
back.
first.
Got you. Yeah,
I'm going back tonight.
yeah. So just be careful with him in the car that he's not under any plastic. Again, just normal room ventilation around him.
He's been in like
Yeah.
one of these type of years.
Yeah. Could I give him some Septrum now, just to kick him off? I think we'll start him with that now, because at least then you could.
Alright, text you the name of the one I've got.
Yeah. Are you sure it's Septrum?
Well, no, I'm not sure, so I want
Right.
to check with you.
Okay. Yeah. It's not good to start him on one and then on the other. I just think he needs something right now because he's so noisy in his chest.
Well, I could go to the vets and ask
So,
them for it.
um,
Reception.
yeah, I would do that. Let's get him started on it now because he's, yes,
Yeah,
very
so
much
let's do
so.
that
Yeah.
and then-
Septrum's really effective.
Septum, I'll just go to the vet. I know you can ask
Yeah.
for a script for it.
Yeah, we've got some here, so I feel like giving him a little dose to help him. Yeah, so I'll go and get that now because he's got problems, and yeah, he's actually urinated quite a bit. You can see it
Wean
there.
costs
So
his
he,
wean so much, but he
Mm.
doesn't seem to be drinking that much.
mm,
Like I don't see him drinking.
mm.
He's producing a lot of it. So that's not helping him.
Could be diabetic.
I'm wondering.
We get guinea pigs that are diabetic, but they do drink a lot. So if he's not drinking, then yeah, that's sort of I would tend to think no. So yeah, I'll get him some Septrum now. So
Just holding it.
yeah, and we'll try that. All right, no, it's all good. Okay, sit down.
Well, I don't think he's ever trust me.
He's adorable. How old is he?
So, I think he's about 3.5, 4. I got him from my neighbour. And he, yeah, I think he was 3 when I got him last year. Like I have been. they were diagnosing me as like giving me.
I gave him 3.5. Give him this tonight. Okay, yeah, when you get it late tonight, but leave it late. And that's like his head. Yeah, so here, take that with you. Okay, and then we need to get some more of that so he can continue on that if that's not acceptable. Okay. Alright. So he needs to have that.
He's fine. He's really great.
I'll come and take a quick video. Actually, Lenny, would you like to do it? Yeah. Lenny will take a quick video. He couldn't walk and he had real walking trouble, but he's now, we wrapped his leg and did all sorts of things, didn't we?
And I still was really bad. He just started to jump.
Yeah. So he's now racing around. If you can get a
And
picture.
I separated
Right in front.
because I feel so sorry for Buster.
Let me just get this and see where it's filming at. I think the SD card should have lots of room on it, so just try video. If it's not filming, then it must be full. Thank you. So Emily and we've got Priya next. Do you think you could find Priya for me?
Oh yeah, sure.
See if she's here. Thank you.
I keep
Priya, come round. Oh my word. Should put that there. Oh, YouTube. Hello. Hi everyone. I'm so sorry, we've been really busy. We've had some very interesting piggies here. I'll do a quick race through the chat. Actually, maybe not. Hold on. Okay. Priya, hello. Who have we?
Lovely to meet you. I've seen
I'm
you.
sorry, it's been so busy.
No, that's okay.
We get crazy busy. Who is this gorgeous piggy?
Daniel.
Daniel. We've got a Daniel. What a great name. We've never had a Daniel guinea pig. So Daniel needs his nails doing. We'll do that for him. How's he going? You got any questions with him?
I just
Hey, Daniel, you're so cute.
with him. I've just noticed when he does a wee, like there's a smell to it,
Okay.
and
Yep.
so I just want to make sure he's okay.
Okay. How old is he?
He's 3.
You're super cute, Daniel. Alright, well done. Might just, can I give him back to you for a minute? I'm going to pop some gloves on before we get personal with him. So, what sort of housing?
So he lives indoors.
Yep.
Just a little
Do you do fleece mats or bubble mats? Or? Yeah.
and we alternate with fleece mats and chips.
Yep. Okay.
And he's got other little brothers, but I keep any sorts.
Yep. Okay. All right. Let's have a look at him. He's so cute. Because he's urinating on his coat a bit, or is that just how he's travelled, or is that what you're noticing?
He was in the grass for a while.
Yeah, he was on the grass.
Yeah. But his coat is just wet, like he's urinating up on here.
He did. He was in the carrier.
So is it a little carrier? His bottom's fine. Just quick clean out there for him. He's good. It's nothing overly standoutish. So when I know, I'm sure he'd little good. Just want to do this for a second. Let's just clear this out. It's all looking fine in there. There's nothing that stands out as unusual. A little bit of smegma caught there. We'll just get rid of that for you. This could be part of the problem as well, because this is on the sheath of his little boy bit and only on one side, which means where he's directing his urine could be going slightly misfiring, if you know what I mean, because he had that sitting there. See how it's just on this left side? So let's just get rid of that completely. It's just saline on there. Exactly as I'm doing. Yeah. Which is... Yeah. So you've not done this before? No. But he's had a little bit on the left side, which means he could be sort of angling back a little bit to because it's an obstruction. Could be. We'll wait and see. You can update me, let me know if that changes, because he's certainly hitting, like he's very wet up here in his coat. But if he was in a little carrier, they can get very humid in there with a guinea pig in there, and the extra moisture is getting very quickly on his coat. So that could be part of it. So you're just noticing it being a little bit smelly. Yeah.
Smelly.
That could also be why. Oh, he hasn't.
The weather.
Okay, and he likes grass time.
Loves his grass times.
Yep. You're doing a good job with his nails. How much does he weigh? Have you weighed him? You haven't weighed him?
No, but
This guy's probably around 1.4, 1.5. He's getting up there.
yeah, everyone who meets
Yeah.
him, like he's quite big, and I'm
Yep.
like, yes.
We've got a couple of boys that hold the record here at 1.8, and he's not quite there, but he's getting up there. He's a big piggy. Yeah, he is. Yeah, he's a big piggy. And so, Felix is number one. He came in at 1.8, and the other boy was a visitor that needed quite a bit of work doing. Was it Toby? There's a lot of videos on him because he had a lot of problems down below as well. Okay, good. Go. Good. Okay. So I would give him a little bottom bath. Have you done that with him before? Yeah, and he's familiar with that. So I'd give him a little bottom bath just to get rid of any urine that's there. And I would just see how he goes after this, because he had that lump of smegma that was caught there. So it may just fix up the direction and where he's peeing. But he looks really good. Has his food changed at all?
No,
Anything like
he
that?
loves his food.
Yeah.
No changes.
He was so sweet. No, he's really great. So, Priya, I would try that. I think that's part of the problem, was that because smegma smells, and if you're picking up that extra smell, it was caught there. So now it's not there anymore. So to do that yourself, put gloves on. It helps, like I didn't use a little cushion for him, but you can just put a little cushion there, but you're literally holding him under the front paws and resting against you, and then from there to look at his little boy bit, you literally have to put pressure here above it, and then slowly it will appear, and then you can see that it's not built up again. That's it, just brush down, goes away. So you can also feel, actually that's another thing I've been showing people, is that, and partly the reason I checked that is there was a little bulge there. When you feel along here, there was a little line, but there's nothing there now. It's just a straight line. So if you feel a little sort of lump, you go, oh, I need to check, gloves on, and check, and because it's building up again. So I would say that the smegma in that position is partly what you're smelling with him. So give him a little bottom bath, and yeah, let me know how it goes. Yeah, I think that's one of the easiest problems we've had today, which is really, really good. And he's super, super cute. You're such a cutie. Look at this boy, isn't he gorgeous? Shall we weigh him? Do you want to find out what he is? All right, I'll show people how to weigh him. I'll give him back to you, and I'll go and get some scales, and we'll show what he is. He's yeah, he's got a bit of a waxy bottom at the back there. So you're used to clearing that and cleaning him there. Just malaseb on that spot. Yeah, and then malaseb, and then wash and remove it. Do you want me to do it here?
Is that too much?
No, I can do that for you. That's okay. Who have we got? Yeah, I can do that. Yeah, that's good. I will do that now. We'll do him a bottom bath and we'll bath. Sorry? Absolutely. Yeah. Nonsense. 20 years we've been using it, yes. It's a product that is designed for dogs and cats, but it's a product we've used for 20 years. And the labeling of it, there's a lot of information goes into the labeling in terms of the testing and so forth, so that they can label it that way. But that's the product we've always used. Never had a product problem, and it's fantastic. So yeah, 20 years of it, like the biggest history of using it ever. Bucket, yep. That's what you need. Just make sure that's level. Okay, so when you weigh guinea pigs, you need to have it to 0. Put your holder on for the guinea pig, and then press tear and it goes back to 0. Here we go. Let's pop them in. And you weigh. There we go. How's that for a guess? I said around 1400. He's like 13.9 to 14.02.
You're so good at it.
Yeah, he's getting up there.
He's a big boy.
He's a big boy, yeah. Saying he's getting up. He's not as big as the other boys, but he's getting up there. He's a decent boy. There we go. So, yeah, call him 1400 grams. 1.4 kilos. give him.
Do you mind if I just grab a towel for his towel?
Yeah, go for it. I've got a towel here to put him in, but you'll need to just finish his towel.
So you just rinse.
So all I'm doing is a little rinse, bottom rinse, and I'm going to literally put some malaseb on there. Just lifting him up so I can really work it through that coat like this. Because it's got a very, see that gland is very oily. It's there. So we just work that in. Would you mind getting for me, actually there's a little comb just there, that one. Yeah, thank you. He's doing poops in there.
Yeah. When do they?
And do they not?
Yeah.
That's right. So we just massage around that area and that just really loosens it, and then you can just take that out like this. So we just clean up that waxiness that's sort of stuck in the coat. It just has loosened it out. So
And how often would you do this?
oh, not that often, only if you notice it like I have today. Don't go that way, little fella. Only if you notice it like I have today, you can just do it, and then it just loosens that. Yeah, it's like
Is that poo stuff on his fur?
there. No, it's his scent gland, so it's very oily, waxy substance.
Yeah.
And when you massage that through, it really loosens it.
Also, girls don't have it.
Not really, no. They actually do have a scent gland, but it's nothing like a boy's scent gland. Yeah.
Is it supposed to be a bit patchy?
Like boys, yeah, it is.
Okay.
Yeah. Some are more naked than others, and because he's wet. Right. He's going, what are you doing? What are you doing to me? There we go, you're done. That's it. Just literally just wrap him up in here. I'm going to give that one to you. Look, sweetheart, you're able to probably just up there somewhere. Anywhere there. Just give your bottom a little wipe down like that. That just gets rid of the, sorry? His audience is still pooping. Healthy poops. Healthy poops. So, yeah, I know, it's not that bad. He's still complaining like, I'm not sure about you. You're not sure? Yeah. Yeah, here we go, more poops. Put that out of there. More poops. Here we go, we don't need any more.
If you think about it, we do like 2
Healthy poops as well.
a day.
They're very healthy poops. So, get rid of that. Healthy poop. But yeah, there we go. He's all done. So that's it. So then looking at his bottom, so he hasn't got any urine in there, and that little waxy area. See how it's now gone? See, gone, clear, and it's nice. That'll dry off really well. So just finish towel drying him, and he's good to go. Okay. He's so cute. He's super, super cute.
He's a baby now.
He has done well. It's good to meet you, Priya.
Great to meet you. Thank you.
It's a pleasure. It's a pleasure. So, oh, let's take a photo of that. That's so cute. Come on over here. Hold on, where is it? Take a photo of both of us. So cute. There we go, both of you. Yeah. Awesome. Thank you. A pleasure. He's super, super cute. It's good to see you.
The donation through the
Suzanne will help you, which would be wonderful. Thank you. Taha. Thank you. No. Yeah, if you've got any questions at any time, yeah, so definitely. It's good to see you. Oh, thank you. It's a busy sort of day. It is. It's a busy day today. Yes. So that was Priya, so Jill. And Renata, is Renata here? I don't think she's here. I haven't seen her yet, so. Jill! Let's get a fresh cloth. What's that? Is that?
Yeah, she was coming up. What colour car is it?
jaw.
No, this is
No?
just a separate one altogether.
Oh, okay. Who have we got today?
This is Lucy,
Lucy.
and she has a blue spot under her eye, which I've been treating.
Okay.
And it is getting better. You might want to look at it anyway.
Blue spot.
Yeah. But she's the one that's got the lump under the
Oh, that you found. Okay. All right. Let's have a little look. I'm getting a lot of lumps coming up here lately. Yeah, it all happens at once.
Yeah.
Hey, hello. Hey, gorgeous. Hi. She's like, I'm going to hide away from you.
Yep, I got put
Hold
back
on.
in the pen, and now I got scooped back out again.
Yeah. Hey, it's all right. Oh, yeah. Yeah. So what are you popping on her eye? Terramycin.
I got my, so I bought some of those glasses,
Yep.
magnifying ones,
Yep.
light,
Yep.
and I looked, but I couldn't see that there was anything in it.
Yeah, there's no damage on the globe.
No.
It's,
I thought I saw a scratch on it.
no.
No.
No. I might use my super ones. Let's try. Just triple check.
Isn't there a blue spot in cataract?
Yeah, these are. It's very much like a cataract with her. It's the whole globe. Yeah, well done. Sorry, baby. Yeah, no, it's not on the surface. This is within the eye. I know. Sorry. How old is she? 2. So. Shape is fine. It's very much like a cataract, but it's not. There's no damage or injury to the globe itself. It could have been that whatever you were putting the terramycin on has sort of sealed it, because they do heal really well. Little scratches heal super well on the globe, so it could be that that's happened and I just can't see it.
Yeah, I looked to see if
Yeah.
there's anything, because the latest
Yeah.
hay I've got
Looks clear
has
and nice.
tons of the grass seeds in it.
Yeah,
So I've kind of chucked it because it's
yeah,
and so I looked in her eye and spotted anything in there.
yeah. I can't see any.
Not to say I missed something, but I haven't seen.
No, the lacrimal tissue looks okay. So, yeah, I don't think you need to put any more in, but I'd monitor it and keep an eye on it. Yeah, if anything were to change shape with the eyes in terms of the globe shape, they're both the same at the moment. But there's a real clarity in there. And so it could just be that it's healed, which is what you'd see like that. So yeah, I would just monitor.
So you think blue will go away?
Fade, and usually because she's quite young, usually to normal, nearly. Yeah, because this isn't a really severe one. If we've got the right prognosis, that's the only thing. Yeah, I believe so. And just watch for things like sight issues for her, which she's obviously coping really well at the moment. Yeah. Have you got any meloxicam?
Yeah.
Yeah, I'd give her a bit of that.
Okay.
Yeah, I just keep her on that for a few days just to make sure that there's no pain associated with it,
Okay.
because they can be quite painful. But there's no marks on the globe at all now, so I think you've sorted it. So yeah, that's good. Yeah, yeah. So she's got a little lump. Let's have a look. What's going on, Missy? Oh yeah, look. Ooh, ouchie. Yeah, okay. It's a mammary one. It's a mammary tumour.
Okay.
Yeah. It's a decent size too. It's actually quite a decent size for one. Yeah. Yeah, when it rains it pours. Sorry, baby. Yeah. That one, sadly, we can't do anything about. It needs to come out. But it is a really decent size.
Yeah.
Yeah. So, to the vet. Yeah, Vet Michelle does a lot of those as well. North Richmond Vet.
Oh, yeah.
So, yeah, to the vet.
Yeah. Alrighty.
It's a simple operation,
Yeah.
but it is a vet that is required to take that out. It's a little mammary tumour. It's not little, it's a good size, decent size, it's very deep. Yeah. So it's not just the top surface, it's quite.
We'll see.
Yeah, you've developed that really well, little girl, because she's black, it's hard to see, but it's there between my fingers. But it is quite extensively deep in the shape of it, so, and it's got some nodules on it. So yeah, I would I'm sorry, I'm just checking there's one on the other way. Yeah, so it needs to come out. Yeah, sorry little love.
Right.
Yeah, we can't do much about that other than identify it. So
In a hurry?
I would in the next month.
Oh, okay.
Yeah, like not tomorrow. It's not that sort of a rush, but in the next month or two, I'd look at getting it out. Yeah. I'd plan for it. Yeah, just Renata was coming through, really near the end of it, which was
I
good.
brought a visitor. Do you want to
Oh, did you? I'd love to see a visitor. Who's your visitor?
Grass in case you need it.
Oh, thank you. Yes, look how this is going. It's getting a bit messy down
Yeah,
there.
it will.
Thanking you. You've been busy round there.
Alright, it's going to regale us.
Sorry?
With the ukuleles.
Oh, to where?
She's going to regale us.
Oh, okay.
Oh, it's very cute. I love the colours.
That's very cute.
Sorry, I should have done that over the
Can you play? Is tuning.
Just a bit, yeah. Well, it's been sitting in my
Oh, there he is. Do you remember him, Suzanne? Beaten up boy. My goodness, look at him, yeah.
He's not as wild-eyed as he
No, isn't he happy?
for him to come through.
Yeah. He never gets to come and see me.
Say hello.
Hello, gorgeous. Look how big he is now. Look at you.
So it's Flynn now.
Flynn now. This little fellow was so beaten up in rescue. He was when he was here. Came in. Oh, had a rough time. Look at you now. Flynn, you're beautiful. He's just gorgeous. He's chunked out and everything. He's really gorgeous. Look at you. Oh, he's just beautiful. Oh, what a lucky
Oh yeah.
lucky home you landed in, hey? He does have the life. The life at Jill's house. Absolutely the best. Yeah, oh, he's gorgeous. Yeah. Oh my goodness.
Might like to visit.
Yeah, I haven't seen him since then, I think.
No.
Yeah. And he was in need of it. So yeah. You're gorgeous, Flynn. Say hello to YouTube, Flynn. Say hello. Isn't he gorgeous, everyone? I wonder if we had him in any videos, just the rescue that we did with him. It was
I
like
haven't
20.
seen it.
Oh, haven't you seen?
I have not with him.
Have you seen the rescue of him?
No.
Yeah, it was on the Central Coast. That was on YouTube.
Was it?
Yeah, you'll have to spot him. He's
What was it called?
I'm trying to think. it was like 23 or 25 came in that rescue.
Oh, I'd love
Yeah,
to see
so
that.
yeah, I'll try and think of it and I'll find
Okay.
it for you. Yeah, so that's the rescue that he came in with. But yeah, absolutely lucky fellow.
Oh, yeah.
He's beautiful.
11 girlfriends.
Couldn't wish for more, could you?
And he's down on the pecking order, aren't you? They all tell him.
Is he top or bottom or middle?
He's top,
He is top.
but he does the girls tell him
Okay.
moves and things, and he'll move out of their way.
Okay.
He's a really good fellow.
Yeah. He's a
Very
gentleman.
considerate. Yeah, he's
Yeah.
very much a gentleman. But I said he's kind of like those grungy rockers, you know,
Yeah.
with the greasy hair and long hair and
Yeah.
things, you know, that the girls love.
Yeah.
So he sort of gets around with his hair all long and daggy.
Oh, he's pretty.
But he
He's a
thinks
pretty
he's
boy. He is beautiful. He knows it. He's gorgeous. Yeah, Flynn, you're beautiful. Yeah. Now you're famous. There you go. Famous
In
Flynn.
the right way, not the rescue way.
Not the rescue way
No,
anymore.
that's terrible.
Oh, it's really good to see them so long after
Yeah.
they take off. So good to see them
Yeah.
when they
It is
come back,
nice
and
to have
it's
them come back.
it is really good
Say good
because
day.
it's what it's all about,
Yeah.
and you get to see them, having fun years on. How long ago was it you adopted? It was 2-3 years.
No, not even that. Like,
Oh, really?
no, like maybe a year ago.
Oh, okay. So it was COVID time. Yeah. Okay.
Yeah.
Trying to track when, because that threw everything out with dates and times. Yeah. Okay.
This time
I was doing beautifully. He's gorgeous.
boy.
Yeah. I'll find the video for you and send you the link. Yeah.
Okay.
I'll let you
Yeah,
know which
I'd
one.
love to see it.
Yeah. I'll do that. Oh dear. Oh, we better say hello to YouTube because we have completely been doing things. So, hello everyone. Oh, I've got the wrong glasses on. These ones. So, there we go.
Oh, was it? Did that?
Right, I'll quickly go back through the chat. I'm so sorry we've not been in the chat today.
Oh, yeah. I was wondering, was it very? Yeah, because they're very.
Let's see if I can go back
They're very
here.
expensive to detox them.
Yeah, which is not bad.
Yeah.
Okay, Jake, I'm sure you've had lots of answers in the chat there, but for everyone else, let's just go through.
Yeah. Oh, does it like? Sorry. Oh, see if you.
Sorry guys, can you go over that way a little bit, just so we can hear on here. That's it, sorry, or you'll be picked up on, you'll be all over here. Okay, so can you do anything to keep weight on older piggies? One of the best ways is actually corn, so corn husks, corn cobs. Corn is fantastic for helping them with their weight, so look into that right away. Regular feeding, supplement feeding, so you can actually add into that things like critical care. Marlene says, Lynn, I just tell you about a guinea pig miracle in a country near St. Louis. A family moved in there and Tuesday in the house was destroyed. Family 4 was okay, house was no longer there. Oh dear, that's terrible. And then a fireman going through the rubble found a guinea pig alive, and his name is Charlie. Oh my goodness, that's heart-wrenching. Oh my goodness, so Charlie survived a house fire in St. Louis. Yeah, my goodness, that's terrible. 6 other animals died in the fire, but Charlie survived. Wow, Marlene, that's really awful, but I'm really pleased the family are okay and Charlie's okay, and yeah, it's devastating. Absolutely devastating. Yeah, house and home, and awful. Hi, Guinea Pig Sue. I'm so far back in the chat now, I may or may not be here. Sally, hello. Charlotte, if you're listening, Charlotte, hello to you, big hello. Beginning of spring with daffodils in bloom. Oh, you've got such beautiful flowers, Marsha. At the moment, some of your photos are just beautiful. I've enjoyed them. Beautiful, beautiful, beautiful. And thank you for sending them. I love them. Yeah, we have different temperatures around the world right now. UK, I've got a lot of snow, but heading into spring soon. Hi, heading into spring soon. Yeah, Guinea Pig, so you heard him sniffling. Yeah, he definitely had a respiratory infection. Yeah, no question. Yeah, the method works really well. Everyone who's using the oh, thank you so much, Guinea Pig. So you've put a donation chat in there. Thank you. Oh, so you're getting back to sleep. Opposite time zones, so you'll have to catch up on the rest later. I'm sorry we were not in the chat much today. We've got so much going on here. Hi Fitz Guinea Vision, hello. Just whipping through questions. Actually quiet in the question area in the chat, which is really good. Everyone must be okay with their piggies, so that's a good thing. Wow, Sally had hail today in her weather. I thought it was funny. Hello, thank you so much. Yeah, if you're still watching, please give a thumbs up so other piggy people can find all the work we've been doing here. May help other piggies. Marion Phillips in Chicago, hello. I know Marsha, he was a big piggy. Definitely what a chunk. So I thought it was funny, had a deaf guinea pig which she thought was deaf but has proved her wrong. Some things can impair sight and hearing, like the piggy earlier has definitely a head tilt. We think it's actually the bulla. But, you know, there are other things that can impair that and can get better and then improve. Poisoning, that's a classic toxicity and poisoning. If guinea pigs ever have that, they can be blind, they can be frothing at the mouth, and literally if they recover, they then go back to being okay. Yeah. I'm going to bring him round and we'll have a look at him. Yeah, come on round. Let me just hang on to him for a moment. Just don't let him run off there. Just till I get to the end of these questions. And then we'll check him out.
You can't exactly see her because she's got a brown fur.
Lots of chat in the chat box. I'm sorry guys, I'm just trying to get through as quick as I can to any questions that are there. Lots of talk about which bottles are best. Basically a non-leaking bottle is best, but I really do prefer bowls for guinea pigs overall. Great, we got to the end. No questions in there. That's awesome. Let's have a look. Hey, gorgeous. So what are you noticing?
Inside the white part of his fur, if you open it, there's like brown spots that are really small.
Let's put these down here. Let me see. Do you want to come around and see if you can find them? might have just been sometimes when they've had shavings.
It was around the side,
Because you know mites are microscopic. You can't see them with your eyes.
exactly.
Oh, there. Okay, I see. Yeah. Yeah, yeah.
Yeah, I was wondering what they were. Little brown spots in them.
Yeah. That's interesting.
It was all around the sides of his fur. Yeah, mostly like here.
Yeah. It's only in that patch, isn't it? Hmm. I believe it could be maybe eggs on the hair shaft. It's not anything live. Just
You
looking at
can't
one
exactly
there.
see it on her though because she's got brown
She's
fur.
darker brown,
She's got
yeah.
dark, but she's got lots of white patches, so
Yeah.
easily see that.
This is Houdini. Houdini. He's been with us a while. What's going on, Houdini? Yeah, it's just in that patch. How strange. It's just marks on the fur. It's
I wonder if that's a cull or something else.
yeah. Just checking other areas. Nothing. It's just literally there. I think it is just. I think it's just him, you know. Because I'm looking at it over here. I don't know, see if I can get some of it. The only thing I would think is maybe eggs on there of some sort. But there's nothing moving on him, and
Is that just a white spot here?
we'll check.
I wanted to ask if you could have a look on my pics later.
Have you got some here?
I am.
Yeah.
Yeah.
Oh
We
yay!
haven't seen you since October.
Oh wow! Okay, I'd love to. Yeah, do an update. Yeah, I think we'll just revolution him again, in case it is anything like that. But it looks like it could be the hair pattern.
It's really funny because
Yeah.
on our guinea pigs we had that for a while and it never hatched into mites.
Yeah.
Yeah.
Well, these are we constantly treat with ivermectin here, so
Yeah.
constantly.
Yeah.
So that's what's really surprising. But yeah, I mean, we get rescues coming in all the time, but they're not with them.
Yeah.
So that's because of quarantine. So we'll just keep an eye on that hair and see if the pattern changes. It's like a
Yeah.
really fine pattern just in that one area.
Yeah.
But you know,
It could be colouring as well.
well,
Because I took one off the other on my guinea pig and it just came off.
yeah.
So it could be some sort of
Well, see, that's more like an egg. That's more like an egg, which is why we'll just increase the price. Can I get you to ask Suzanne if he could have some more ivermectin on him? She'll put it on him now. Thank you. And we'll do all the little ones. Actually, all the little ones can go in with them. So, yeah, is that?
Yeah.
So that one as well. So that one will need ivermectin because he's with them. So yeah, maybe just do them all again now. Yeah, yeah. If you do the whole batch, would be great. Yeah. No. How are you? We'll talk later. Yeah. So, yeah. Surviving.
So this is Woody.
Is there anything to do? Woody! I haven't seen Woody in ages. Let me move this off just because Houdini was on there.
I probably haven't done those nails because I'm horrible with nails. And his tooth is still not growing very well, but
Yeah.
he's eating.
Yeah.
He hasn't stopped eating.
Yeah.
But he's just the vampire sort of
Yeah.
teeth.
Okay.
We will see. And sometimes he does funny noise like
Oh, okay.
but I heard
super cute. Suzanne's just got it over there. I can put it on. Yeah, he still lost a bit of weight.
He did.
Yeah. Yeah.
James was scary.
Oh, was he? Oh.
He had been in the bedroom.
Yeah. He looks good. He has lost a bit of weight. Have you weighed him?
No, I didn't.
His breathing's okay. It's clear. But yeah, he's lost a bit of weight around
I
there.
think it might be because of the teeth.
Yeah.
But
Yeah.
at the same time, because he eats slow, the girls just eat slow things.
Yeah.
And then, so he eats it.
Yeah.
He's not, he hasn't stopped eating.
He just takes. Yeah, but if
His
they've eaten it
behaviour hasn't-
first,
Yeah.
yeah, then there's nothing for him to go to. So he's not getting as much. We had Choc, Piggy here earlier. Did that. His buddy was eating all the food.
Oh, really?
Yeah. Yeah, his buddy's hoovering up because he's got a head tilt. And he's eating and chewing. He's got great grip strength. His teeth look
He's
great.
just slower.
But he's just slower. So
Yeah.
much slower because his head's on the side.
Yeah.
Yeah, so. Yeah. These things. Be a bit better, Woody.
Oh, we wanted to come in. Oh, you're on YouTube.
Yeah, it's on YouTube at the moment.
We wanted to come before, but I just couldn't.
Oh. It's like, yeah, what do we touch? I didn't do anything. I bumped his other foot. Yeah, we haven't been live for the last couple of weeks. Yeah, we've had so much on. You know, Ben had an accident. Yeah. No. No. There's got quite a bit of recovery to do. Do you want to cut your other fingers there? Little digits. Go. Yeah, no, he really hurt his foot.
She said that he's wearing kind of like something his knee on it.
Yeah, scooter. He's on a scooter. Can I cut it there? Let's see. Yeah? Yeah. Okay, a bit close. Good. Yeah, no, he's on a scooter,
Yeah.
but he's got a fractured wrist as well. So he's lucky to be alive. We can rebuild him. That's the stage we're in.
But he's like, so he's not working. He's not doing
Oh no, he can't. He's on his bed at the moment. He was working for 6 weeks down the south coast. It happened down there. He was coming up the next night, the next day I should say, and he went for one last ride. So yeah, one last ride. He's lucky. He's very lucky to be alive because he had an arterial bleed. So yeah, it's not good. Not good at all. And it was right when, if New South Wales Rescue by any chance are listening, which is very remote, they will be, but they were striking. The ambulance was striking at the time. Yep. So you could ring 000, but 000 couldn't reach any ambulance. So they just kept him on the line so they could get him to the hospital. So yeah, it could have been really bad. And then because they were on strike, he should have been flown to Canberra because it was so serious, and Canberra were upset that it didn't happen. But yeah, he went by road, and they had at least transport service. But yeah, he should have actually flown, which he was disappointed about. It's like, well, he wanted to fly. That's not the way you want to fly. So, yeah, there we go, Woody. Let's have a look at your teeth. Yeah, so that's not how you want to fly.
Although he has a big recovery now, like is he gonna recover like he said, right?
Yeah, it's going to take a while.
Take a
Yeah, his foot's got a lot of work to be done to it. His wrist is fine. It's going to be okay. But it's his foot has a lot. Because when you've got bone injuries, you've got fractures, breaks, and then compound breaks where they come through the skin, and then you get crush injuries. And he was a crush with a compound, so it's not nice. Oh yeah. So his body's got to do a lot of. Oh, look at those crooked teeth you've got there. What the heck?
You adjusted them when
What
we came
the? Yeah. Oh, crikey, he's fast. Did you see that? Oh, you tried to bite me. You tried to bite me.
Better before.
Crikey, he's like, don't you touch my mouth.
It's probably like in pain in there.
Oh. Oh.
He was in pain.
You're not happy. No. Okay. Crikey, you have to take a picture of this. I don't think I've ever seen a divot quite like that.
Oh goodness.
So, Woody. Here we go. You can turn that on. You can hold it and see the front of his mouth. It's just filming now. Look at the size. I know he's trying to get me. He is upset with it for sure. Look. Oh, you're going home. Thank you so much. Thank you, girls, so much. I'll hear from you later. Okay.
Nice to meet
Cheers.
you.
Bye. Bye.
Oh, there's a third one coming out.
Look at that.
Gosh.
So he's got a big divot, which he's eating through at the front. Yeah, like matches up perfectly. And the top. He's not happy. Woody. Oh, stuff stuck in there as well. Yeah. Just put those on. Yeah, you can stop. Thank you. So yeah, Woody. Yes, definitely this is related to it for sure.
Yeah. I'm trying to give him additional food,
Yep.
or when I give the girl like vitamin C and so on, I
Yeah.
always make sure that I give him
Yep.
separate.
It's okay. It's all right. Yeah.
But
He's actually got some extra teeth in behind. He has. And look at
he's not happy.
it's like
But he doesn't like
you don't
that
usually
before.
get a guinea pig chomping straight down. That's a chomp, not a grind. Move. It's like I'm gonna seriously bite straight down, which he does. Yeah, if you come around here to my left, if you can, you'll see. So I think he needs to go see Alex Rosenwax. Hey,
Okay.
Woody, stop it. Stop that. Stop that, Woody.
Who is Alex?
Alex does teeth.
gosh.
Look, see in there?
Yeah.
Yeah, so they're actually little
Yeah.
teeth coming up through there.
Yeah.
He needs to get that dealt with. Woody. And he's got the one in the middle there. You can see it's all these teeth.
Yep.
Hurly dooly, Woody. What the heck? Yeah. It is
What would you
sore.
do with this type of thing?
It's-
I know that he
well,
deals with teeth, but
You can actually feel in his gum here
yeah.
that this is a normal size, but this size is swollen.
Okay.
It's much bigger.
Yeah.
And like he's got that, what happens is they can get really infected.
Yep.
Just gonna again to touch you, Woody. Yeah. Cheeky, I just want to see if it's loose. Yeah, it's not loose at all, so you can't dislodge those because they're
Yeah.
solidly embedded into the gum, but you can see
Yeah.
how distended it is here on this side. That's why he's not liking me touching him.
Yeah.
And the papillary color is redder down here.
Yeah, it looks
See
a
how it's
bit,
much more inflamed?
Yeah, it does.
Yeah, than this side. So
Yeah.
I think, Yeah, I think the best way really is to see Alex with that one.
Who is Alex?
Alex Rosenwax, he's in Waterloo. Yeah, and that's going to be the easiest for him.
Alex? How do you
Alex,
spell
Roscnwax. ENWAX. Yeah, Rosenwax. That's it. Yep, that's him.
Bird exotic vet?
That's him. Yeah.
Okay.
If we can show YouTube your little smile, can we do that? Not sure if everyone can see or not. Maybe not. We can try and have a look in there and see what his rear teeth are doing as well, but they're pretty crazy at the front there. So we could trim those back, but
No,
there's no
should
point. It's
be.
really
No, no.
complex.
Yeah,
I
yeah.
just think no,
No,
you
no.
need to go the other way. So he needs to go right to Alex because you're complex. Yes, you are, Woody.
Oh, it's now south. It's actually south.
What's south?
Oh, the place, birds and exotic
Yeah,
vets.
yeah, yeah.
It's
He's at
south.
Waterloo. Yeah.
Okay. Oh, I don't know what's
Oh,
Waterloo. I didn't know
oh,
where
okay.
was it. I was like, oh,
Just
okay,
over
wait.
the bridge.
Yeah.
Haymarket. Okay,
Yeah.
come and have a look in here. Let's see what's going on. Woody, up. Woody, 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 Woody. Hold on. Woody. Hold on. Let's just see. Oh, you little devil. Okay. Get there. Missing. Hold on. Can you just put your hands on here? Just on his body there. Thank you. Wait, you can't go down. Just up. Come on, just want to have a peek. Okay. Well, they're not across his tongue. Woody. Woody, it's okay. Woody, Woody, Woody. Hold on. Hold on. Yeah, from what I can see, it's the front.
Yeah.
Yeah, and it's
Because
down at that
every
joint.
time
Yep.
I give him vitamin C.
Yep.
Independent of the size, we put it back.
Right.
Straight it back.
Yeah. 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 So.
What we do, we chop in small pieces. So we give it to him, he can chew it properly at the back. So that's what I mean.
Yeah.
Yeah.
It's really good.
Yeah.
Okay. I'll have to show you a trick with a syringe.
Okay.
If you're giving it to him and he's taking it okay, it's all right.
Sorry?
Is he taking it okay off you?
Yeah.
When you, okay,
yeah.
all right, that's fine then.
He
Yeah.
loves it. He takes it straight
Yeah,
away.
so
Just
he-
because he's not splitting them.
Yeah.
Because normally they split them with the front tooth,
Yeah.
but he's not.
No, he definitely needs that because the
Yeah. I would definitely
the
contact
base,
him.
yeah, the base of that tooth is just,
Strong. Yeah.
it's like nearly double the size. Yeah. Thank you.
She's fine,
Mel.
healthy, probably just a day or two like horrible with.
Hello, Mel. She's gorgeous. I remember when she's so little.
She was.
She's so little. So little.
I was wondering if I
were.
got her in 2020 or 2021.
Oh, thank you, thank you. We have to look it up. I have it in messages, yeah.
I think it was just
Are you heading off, Jill? It's good to see you. Yeah. Keep me posted. Yeah. Okay. All right. See you. Yeah. Michelle is really good, so I recommend her for that. Yeah. Richmond. Yeah. North Richmond. North Richmond vet. Yeah. Michelle. Yeah. Yeah. She's really good. Okay. Cheers. Bye. Cheeky thing. Cheeky thing. How about that? Eat that. You can eat that, hey? this so you can see. Oh, come on, put that one there. These ones are really only the tips,
Oh yeah.
so not too bad.
Jane sometimes does that.
Oh, okay, well he's done well with that hand.
I'm the one that's horrible with them.
That one was a close call at some point. That's pretty clear, isn't it? Like, give me the food. Yep. Can't quite see there, Missy. Because of the position you're in. That's better. There. Okay, just gonna uphand her like this. If you can keep her feeding, that's great. You have to sit there, you see, and eat for a minute. There we go. Oh, it's all right. Don't want me to touch your ears. Why not? Oh my word. What's wrong? It's like, don't touch my ears. Why not? Why not? Look. Is that better? You want to hide?
Is that bad?
Hmm? No, no, not at all. It's just a bit dry in there. Boy, oh boy. Come on. Scamp. Yeah. Can't trust you. She's like, you are not doing those ears. Why not? I don't hurt you. See? I don't hurt. Is that okay? Yeah. Good girl. It's okay. It's okay. Oh, she's very sensitive with this ear, isn't she?
Sorry?
She's sensitive with this ear.
Is that normal? They're working?
Yeah. She's a bit more jumpy than.
It was a fly thing though. Is that normal?
Oh yeah, that's not all normal. Just checking she hasn't got anything. Yeah. Oh, she's got a lot of fungal there.
Oh really?
Yeah, here, look. See under here? Yeah, I think that's why she's
Oh,
doing it. Okay. Alright, it's okay, little girl. Let's just soften that. Yeah, that's all it is.
how do we do that?
Ah, I'm just getting it out now. That's why she was sensitive with it, but yeah, just
Yeah.
she's wondering why she's jumping with it. It's like, that's alright. It's okay, it's alright. It's okay. It's alright. There's a big bit there. She may have been trying to, I know. It's okay. We've been trying to scratch your ear. Maybe.
So once that's
She's very sensitive about it. Some piggies scratch their ears and she might have sort of scratched it and it's a bit sore, but it's her ear that's bothering her.
once that's clean.
Should settle down, yeah. It's okay. Yeah. Just make sure there's these big bits that she's probably trying to. They're just dry, hard, scaly bits, but might have been making her ear feel a bit unsettled. Yeah. Yeah, it's okay. It's okay. No taking off, please. with the ears. Okay, that one's done. Let's go back to the other one and make sure that didn't have it. Yeah, it was. Oh, there's a little bit there. Yeah, there's a little bit there, but not
Not as bad.
not as bad. It's not bad. I just think maybe it's what was making it a little bit more sensitive, uncomfortable. So it's just sitting there. I'll just let it sit. Yeah. I know. Yeah. Come on. Oh, goodness. Hey. I think it's been a while since she's had it done, maybe.
I know.
She's like, oh, what are you doing in there again? I'll just, no, let's fix it. Hold on. Hold on. Does it tickle you? Tickle you too much?
She has attitude.
Attitude, she does, doesn't she?
Yeah.
I got it. Okay, yeah, you're good. All right, cheese, awesome. That's okay. Oh, my word. Cute little piggies. Cute. They were adopted from here many years ago. Let's see who's next. Oh, hi everyone. It is now 5 p.m. in the afternoon here. I know you were trying to work out times. So it's 5 o'clock in the afternoon. Good to have you here, Fitz. Okay.
That's Pippa.
Pippa.
Pippa had something on one of the toes.
Okay.
I haven't checked actually. But
She's a lucky girl to be with you. She is. They all are.
it's fine. I don't remember which one was it.
No, they all look fine. Just trim them up. You can't see anything untoward there. Not swollen or anything, no.
And her dummies, is that right?
Yeah.
I just saw some.
In her tummy.
Yeah, like on her.
Yeah.
face.
No, I just checked down there. She hasn't got a stone or
Ah,
anything.
okay. Yeah.
Just, yeah. Actually. We'll
think
watch
she
her
was
because there's
pressing
actually,
her.
yeah, there is a bit of a lump further back, but I would just leave that for now.
Okay. Because I think last time you were checking her for that.
Yeah,
Yeah.
it's still there. There is a hard nodule still there. Did she have one that she passed?
I don't know if she actually passed. I do remember you mentioned yours seems like very small, but let's just wait.
Wait, yeah,
Yeah.
okay. Yeah, she does have a lump there,
Okay.
but it's not gotten obvious, and it could, given the time frame, she could have passed one and that could be another.
Oh, okay.
Some piggies just
Keep doing it.
keep doing it, yeah. So,
You're much better behavior than your mate.
yeah, she was a bit naughty, wasn't she? Just a little bit.
She has attitude.
Yeah. Oh, can't see there. Let me do it this way. That's better. Stay there. I think she just realised there's nails going on, there's nails. It's like we've been doing it for a minute or two. Yeah, she's all good. This here just needs a bit of a wipe. And this one feels soft. We've got one soft, one a bit harder. Oh, you don't like it either. Better right away.
That was dirty.
Yeah, it's just a bit dry in there, that's all. Whoa, don't run off, little one. I know. I'm not having you go anywhere. No. So you can't run off the table. No running off the table allowed. It's not allowed. Miss Pippa. I don't think your girls have had. I'm not hurting you. It's okay. It's okay. Oh, she's almost offended, isn't she? Your girls are so colourful with ears. My goodness. I'm not hurting you. It's like you're poking me. Yeah, I'm doing it very gently. Very gently. Look. Look, Missy Moo. Look.
I think this was the most the pig that screamed the most here.
Yeah, she is the most all day.
Oh yeah.
She's a little pig screamer for the day. There you are. There. She's done. She's cute.
Just got one more.
Oh, there we go. Screamer.
Yeah.
Isn't she just? Oh, screaming piggies. Oh my word. Mm. See who lucky last is. A big thank you too to Emily and Jessica who came today. They were here helping.
Oh, they were lovely.
They were lovely, weren't they?
Lovely.
Yeah.
Yeah, this is the suicide. I remember that.
She's a suicider after the other ones. My word. All these little girls are... Okay, we're not even going to play that game with you, Missy. No, we're not. No, we are not. I'm not playing. No, I'm not playing. You can sit there. You are not running off on me. No. That's pretty good. Can I have this one now? She runs so much, they're pretty short.
Oh, I think
And the
probably
odd
James,
one?
James probably
That's
had
her.
a dream as well.
Yeah.
I think from my memory he probably did.
Yeah, yeah. Yeah, I heard
There's a big
she's
one, though.
pretty good. That's
That
a
one's
longer
so good.
one. Yeah. Let's get these up so I can make sure we don't, that I can see everything. She jumps when she has it done. She's very cute.
She's just scared of everything.
Yeah. No one's
Traumatized, I
gonna,
assume.
no one's gonna hurt you. You're so cute.
She got much better though.
Yeah. Oh, you put that one out for me, didn't you? You did. You did. Good girl. Wait a minute. Good girl. Now, let's take a look at your ears, but no running. You see me? Show hers. Don't feel too bad. A little wipe. No screaming. Just like, okay, I'm ready to run. She's not got too much there, so that's good.
It's funny how they're all different, although they live in the
Oh,
same cage.
no, they're all different. Absolutely. Yeah, people often make that mistake because they pick up one and they go, oh, it's, you know, it looks fine.
Yes.
This is fine, that's fine. And then you realise it's actually another one's got a problem.
Yeah.
So, yeah, there we go. You are the best behaved
I couldn't
of
believe
all
it.
of them.
Maybe because we're already prepared.
Yeah. No. Just checking you down here, Missy. Yeah, she's good. There we go. She was the best.
Thank you so much.
She's a big piggy. She is. Oh my word. Okay, I think we've got. Let me just go and see. What's the bad name in guinea pig language? I think I missed it. If I said it, I'm sorry. I apologise. Hold on. I'll be right back. Okay. Run the home run. Home run, everyone. Right. Get some fresh grass here. Let's see. Sorry? Oh, good. Oh, this is the one that we had, that we did.
Yes.
Okay, we should film her.
I just noticed that.
Yeah. Hold on. Let's do that one. Video. There we go, that's ready to turn on. And let's look at you, sweetie pie. What's her name again? Stitch. Stitch. Is it Stitch Gorgeous? This is Stitch, everyone. There we go. If you can press record and then just focus. Yeah, just press that. Yep. And then just focus where you can see her. Can you see her? So this is Stitch, and we had the sister. It was down here somewhere, wasn't it? Oh, here. Yeah. Okay. Right here, Stitch. We're going to have a look at it. Yes. So the scab has come off now. We're just going to clean that up for her. Okay, good. That looks great. Looks really, really good. Yeah, nothing there, which is how we want it. Stitch, so we're going to use just some saline on this. Sorry, Stitch. Sorry. She says, don't touch me there. Can I touch? Can I? She says, no. I'm not going to do anything. this on. That looks really, really good. Yeah, healing very, very well. So how long ago was it? Was it 3 weeks? 2 weeks?
I think 2 weeks.
2 weeks? Yeah. So 2 weeks later, which is great. Okay.
And the scab just fell off.
Can you see
During
that
that while I
close
was
there?
traveling.
See that close?
Yes.
That's great. If you press stop with that, that's great. This is a little sebaceous cyst which was removed 2 weeks ago, and we'll do the full details on it later, but you can see the scab actually fell off on the way over, but you can see nothing is there. And we'll let you follow along with stitch as well. You're doing really well, little girl. That's great. Yeah. This one. It's amazing, you know, when you put these glasses on, you think you've cleaned it, and then you actually see right under, and you hadn't. Sorry, Stitch. It's still delicate and soft there at the moment. That's it. It's off. Right, so what we're going to do is just put a little bit of an oil on there. Just sit that there for a minute, and just going to massage that around so it's in over that area. I just want that to be on it. Okay, and she can have that on for the next week or two. If it's looking like where that scab's come off, it's a little bit red, a little bit sore, just that will settle it down really beautifully. So that's all. We can put a little bit in the tub for you as well, because it's a huge bottle. So, and just use a little Q-tip, just as I've done there. Put that on and cover that area. That's all it needs to happen. Just let it continue healing. So she's great. Well done. Well done, well done. Definitely.
Like a few months ago.
Yeah, definitely. That would be great. Yeah, we haven't done a follow-up with her, have we? I don't think we've actually released that video either. Oh my word. I'm sorry everyone, I'm really tired and yawny. What a big day. Big day, big day, big day. It was, wasn't it? Oh, this is Snowy. We'll have to film her as well. Is that camera there? Oh, great. There we go. Let's do that for Snowy. There we go. And that one, and that one. There we go. So we've got an update for Snowy. And, oh, I can feel, I think. No, I can't. She had a massive abscess. Is it an abscess or a sebaceous cyst?
It was abscess.
It's an abscess.
Bitten by her mom.
That's right. Yeah. It's so long ago. How long ago would it be now? Maybe
Maybe like, what it was, 6 months.
6 months, yeah. It was there somewhere. It was
Yes.
huge and all gone. Gorgeous girl. All better. So that's wonderful. Yeah. It's good to do follow-ups like that. But it was in an unusual place, but it was a bite wound. And look at her now. You're gorgeous. Do you want some of this? Want some of that? She says, no, I want to run. Thank you. That's great. Yeah, no, that's fantastic. Well, good. So for YouTube, this little girl had an abscess, a leg abscess, which was in here. It was quite large, and so we treated that. We'll put her story out later, but this is her follow-up, which it's been months and months and months. And abscesses, if you're on top of the infection and drained it, they don't return, so that's a good thing. But yeah, she's in good spirits. She's like, Mom, take me home. She looks really good. So that's awesome. Oh. Oh, thank you. Yes, yeah. Yeah. Yeah, and it was lovely. Yeah, they were good help. It was nice having them here. I know. I know. It was a case of no, can't really do that yet. Yes, they did really well. Yeah, they did. We're just going to change this over now. Okay. Hold on. Okay. Hi. Billy. Hello, Billy. How's he doing?
He still eats the carrots.
Does he? Yeah. Okay. See what's going on with your teeth, Billy. Do you want to do his ears? Or is he okay? Okay, they're a little bit hard. Yeah, so yeah, I would do his ears. Let's do those quickly while I've got him here. Mr. Billy. Yeah, when they start to feel a little bit like hard, sort of, I guess the feeling is like just harder than normal hair. It's like when you rub over, it's like, then it's time to just do this. But that's right, we just do them. Something and nothing. I did lots of ears today. It just sort of brings off these harder lumps that are sitting there. That sounded like Bellamy's having a moment. so than his buddy, or still both?
It's hard to say because they're both eating the same spot.
Yeah, 'cause it's been a while since we've seen them, hasn't it? Look. Other ones on here. Easy. Okay. Still good down there. Very strong breath. Grassy breath. No, he's looking good. He's looking good.
So the
So-
filing.
Yeah, we'll just try again with that. Are you able to pass me a tissue just up there? So, yeah. Thank you. Okay, Billy. Take those off my eyes before I go square right. Come here, little dude. Just needs to do this again. He's doing really well in there. Yeah. Whoa. What are you doing? What was that? What was that? Ready? What was that? I think because he had a full mouth back there. Okay.
You can hear it actually.
Yeah, you can. Yeah, when he gets a hold of it. There he goes. Good boy. Good boy, Billy. He knows exactly what to do with it. Yeah, so maybe bring him again on Wednesday. Yeah, so we can do it twice. He's like, it's not even spitting out. So this is great. Is that good, Billy? Good boy. Still going. Still going. We're finished. Okay. Good boy. Good boy, Billy. Okay. He's good, so we'll see him again on Wednesday. Yeah. Yeah, he's doing okay. That's a good thing. So good to go. And we'll see his buddy. Is this Dumbo? Is it Dumbo? Here's Dumbo. So cute. He's so cute. Hello, Dumbo. I think that's a great name. Hello, Dumbo. Look at this beautiful boy. This is Dumbo. Isn't he a gorgeous boy? Hello, Dumbo. Oop. Just gonna check your little teeth first. You see, his ears are soft. It's the same. It's insane. Yeah, he is. It's the Abyssinian. Yeah, dense fur. Let's have a look here. Looking nice. Looking good there. Looking good. Let's see. Back up. Oh. There, come on. Boy, there's a grass smell in there. Just let me see. Come on, let me see. Okay, same. Same. So that's good. Smell. Strong green mouth in there. That's good. Good boys. Not the right spot. Right place. Do you want to try again? But his don't look bad at all. So yeah. So yeah, he's good. So that's fine. It was just and is he leaving more carrot than this boy? Yeah, because he really wanted to grind. This guy doesn't want to, so it sort of matches it. Yeah. Okay. Well, we'll keep on keeping on. So really, it's him next Wednesday. Yeah, we'll do that.
But I think both of them so they could keep each other company.
Yeah, for sure. That would be wonderful.
Thank you so much.
No, that's okay. We will pack down here. And, oh my word, everybody. Hi, we're back. Oh, I can barely see through those. They're too close. I need these. I need adjustable glasses. So, we have reached the end of the day. And I just wanted to say a few thank yous to our online community here who have been looking after the chat area. Thank you, Marsha, so much. Thank you. I thought it was funny for dropping in and all the support that you give us here. Please like and share this video if you haven't done that, so that it can be spread to other people and who need to find the information. And yeah, to all the team here of volunteers. We've got 5 people here. For 5 people here we've had Suzanne.
1, 2, 3, 4 at the moment, plus 2 girls.
2, 4 plus 2 girls and 6. Here's
It has been a
Suzanne.
phenomenally busy day with health checks.
Come on
we
round,
have
Laura.
had 2 adoptions. But young people have learned a lot.
Yes,
So
we've
that
had
was
some
wonderful.
young people helping us. Come around to Lily. We've got everybody here. Look at this team. These awesome people. And Renata, you're going to come round. Come on. Come on. Come on. Come and wave. Come on. Just wave. Come on. No, come and wave. It's okay. And Renata is camera shy. So, and
Another one of these someone else gave us. The,
oh, fantastic.
the lovely people with the boys with the head tilt.
Oh, Joven.
Yes.
Okay. Thank you. Oh, wow. Okay. So, thank you, because we've had a few people drop things in, like droves, and there's a huge box around there that the community actually got together, which is fantastic. Yeah, it'll be wonderful for them also. Just thank you for all the support that we have out there. We need it, so please spread the word. We've only had 2 adoptions, despite so busy. Is it 2 adoptions
Yes,
today?
just 2 adoptions.
Just 2. You know, that's a really, really low number, and if we don't have room, then we can't have room for others to come in. But as it is, we have a massive waiting list anyway. So, but thank you for all of your support wherever you are in the world, and for watching and catching up. If you are watching this on the playback in the next few days, just you won't have your comments show in the comment area, but you can comment below the video and we'll then reach out to you. So that's it from us. So yeah, thank you
Stay well,
everyone.
everybody.
Stay well. Bye.